Welcome to the Health and Climate Crisis Conference, Integrative Approaches for Individuals and Communities. My name's Jacqueline Burrell, a soon-to-be Doctor of Naturopathic Medicine, graduating in June from Bastyr University in San Diego. I'll be your MC for the day, and it is truly my privilege and pleasure on behalf of the organizers and sponsors to welcome you here today. There's a closed captioning feature that you will have to turn on yourself if you would like, located in the bottom bar of Zoom near participants, chat, and reactions. So when I was 18 on summer break from University of Vermont, I took a leap and became an intern living on a 7-acre biodynamic farm in the middle of nowhere, Michigan. And that is where I truly understood the healing power of nature. I ate my first green zebra heirloom salad tomato, and that was my aha moment. What could be better medicine than food grown with intention and herbs I tended myself? Food is medicine, and it is something we all deserve to have equal access to. I hope you're ready to be inspired by today's speakers, and if you were here yesterday, welcome back. Next, I would like to introduce to you Dr. Lev Elson-Schwab, who will be giving a land acknowledgement, followed by Claudio Rodriguez, an environmental justice organizer, and spoken gratitude by Dr. Kathleen Lumiere.
Thank you, Jacqueline, and welcome back, everyone. I think we had a fantastic day yesterday, and I'm excited for today's sessions. If you're joining us this morning for the first time, my name is Lev Elson-Schwab, and my grandparents came to what is now known as the United States when fleeing religious persecution. I'm really humbled to be a co-organizer of this meeting, to serve as the chair of the Bastyr University Faculty Senate, and to have been asked to share this land acknowledgement on behalf of Bastyr University. This conference is a collaboration between North Sound Accountable Community of Health and Bastyr University. We continue our learning and practicing of tribal land acknowledgements. Our meeting today is hosted on the traditional lands of the Coast Salish people whose spiritual connection to the land forms the foundations of their ways of being. Let us consider how we make space for their voices to be heard and how we can humbly build relationships with these knowledge keepers. Please join me in a moment of reflection as we consider the complete history of Indigenous peoples whose deep connection to the land can teach us about the intersections of climate and health. If you're interested in learning more about the land where you live, work, and play, we invite you to visit nativeland.ca, which you can find in the chat, and please feel free to use that. We appreciate the time that you spent in reflection, and we really hope you enjoy today's sessions. Thank you very much. Jacqueline?
All right, next we have Kathleen Lumiere, who will be doing some spoken gratitude.
Thanks, Jacqueline and Lev, for those welcoming opening words, especially the land acknowledgement. They ground us in our coming together to learn about and improve health during this climate crisis, which is the largest intersectional problem of our time. This conference partnership of the North Sound Accountable Community of Health and Communities of Color Coalition with Bastyr University has been an example of the effectiveness of such an intersectional approach. We at Bastyr hope to continue to foster these relationships in future with reciprocity, attentiveness, appreciation, and action. Thanks also for the trust and generosity of other sponsors, namely the Naturopathic Alliance and the Washington Association of Naturopathic Physicians, as well as private donors. All financial contributors have made it possible to provide speaker honorariums and make this conference freely available. So many people's good work has gone into this event. Liz Baxter at North Sound offered material support and the organizational expertise of Tiffany Edlin, Nicole Willis, and Nika Osteen. Jackie Julian, the director of C3, shared wisdom as well as funding, and Ben Young was a stalwart presence, ready with insight and good humor. From Bastyr, Lev Elson-Schwab believed in this vision from the onset. I could not have wished for a better champion of the idea to create a program about the health effects of climate change. June Klobeck suggested that we host a conference before offering classes, and here we are. Also, she and Ann Kennedy built our Canvas site. Krista June pitched in massively as part of her own studies on the subject of health and climate. Mary Purdy reached out across her broad network to share the event and attended countless meetings, sustaining keen attention to detail throughout. Daniel Van Arsdale, invited to the organizational team at the recommendation of DEI leader Quartet Mensa, shaped the endeavor in ways too numerous to mention, but that can be summed up in one word: community. Daniel brought Brian Carroll and Logan Roast on board. Logan introduced us to the gracious tribal educator, JJ McMines. Brian has proved invaluable in outreach, funding, and suggesting our wonderful MC, Jacqueline Burrell. Bastyr Provost David Rule gave much needed and appreciated institutional support, as did VP Jeannie Galloway and staff, Rose Walker and Lee McBride. From the network of climate activists in Seattle, Megan Slade and Heather Price brainstormed, made introductions, and helped make this event happen. Thank you, key conference organizers. Abundant thanks to our widely diverse, brilliant, passionate, and deeply knowledgeable speakers and panelists. You enlighten as you go and lead the way. Thanks to each of you participants in the conference. This is from you and for you, and I cannot wait to see what you do with this information and these connections. Last, but really first, gratitude is to the earth, the water, the sky, and every species, beloved home and family to us all. Thank you.
Thank you so much for that. Why don't we just go ahead and get started? So our first speaker will be on food sovereignty and nutrition, Claudio Rodriguez. So Claudio is a migrant, an OG, organic gardener / gangsta, part-time artist and environmental justice organizer in Tucson, Arizona. He works with the homies, greening the neighborhood. Claudio has over 10 years of community organizing experience in migrant, environmental, and food justice issues. His works include creating opportunities for green infrastructure in marginalized communities. Along with that, he has helped develop school garden programs throughout the Southwest that cultivate outdoor learning spaces that foster respect and advocacy for a just food system. Welcome.
Hello, thank you, Jacqueline, and hello, everybody. Thank you for welcoming me into your space. I'm on the traditional lands of the Tatana Atam people, right here in Tucson, Arizona, and it's just really good to be here. To share just a little bit about my experience, why we do what we do, and why this matters. Why does health and climate change? How do they intersect? How do they intersect with our lives? How do they intersect with our experience? And then how do we join the fight, and how do we inspire others to join the fight with us? And I'm gonna go ahead and share a little bit of some screens, because I want y'all to experience some of the work that we've done and we've put together. And with this, let's see, how do we do this slideshow? So what I do is I'm an environmental justice organizer, and we've coined this term called barrio sustainability. And that's to relate folks into the work, to bring them into it, because usually when we would hear the word sustainability, green infrastructure, when we would hear about environmental issues, it never reflected us. So how do we reflect that, and part of my experience is bringing that reflection to the work of what it means to go from gangs to gardens, what it means to be a migrant in a time of climate change, in a time of nutrition and food apartheid, and what it means to be an indigenous person in this struggle. And how do we do that? And I do it through being an educator, going into schools, going into the juvenile detention center to talk to kids about why this is important, why they should care, and how does this reflect. So our work is based out of Tucson, Arizona, but it's really about a regional section of our world and how do we incorporate folks, and how do we incorporate struggles and fights like Black Lives Matter? How do we incorporate fights that talk about land access and not just land acknowledgement, but also that land back piece of that movement? And when we look at our community, it's really like we're not outnumbered, we're out organized. And part of it is our community deals with so many intersections of food insecurity, of right here in the Southwest, we're going to be dealing with heat waves. And what happens to our food? What happens to our farmers, to our local farmers, to our regional farmers? And what's the treatment that they're facing? So with this, we have to be able to address the issues that impact us, because they don't only impact our health, but they impact our well-being of our political struggle, our political process, of our environment, our communities. What do they look like and how can they look like? And who has the say to say what they look like, right? Because that's also health. I live in a community that has like about 50 liquor licenses. I can get liquor quicker than I can get filtered water. And that's a problem. That's a health problem, because that addresses access, opportunity. And people ask, why do we do this? And it's really just as simple as challenging the status quo and working with youth. Because if we work with them, they're going to see the value that they hold, the power that they hold, and decisions are being made for them on an everyday basis, from school lunches to the liquor stores and the fast food stores that they walk by on their way home. And we have to be able to train them, educate them, and inspire them to join this fight, to know that they have the power and reconnect to the land. A lot of the kids that I deal with are indigenous kids. They're Mexican, they're migrant, they've been in Tucson for many years, but they've lost that connection to land, because this is something that always happens to us. We get disconnected because if we don't feel connected to something, we're not going to want to fight for it. So that's my role, is to bring that material change that we want to see in our community, and holding folks in power accountable. Because when I talk about the design of our communities, is that someone has to say yes. Someone said yes to that fast food, to that
Yeah,
fast
I
food
mean,
restaurant.
when I look at how marginal.
Oh, I'm sorry. I thought that was a question. Yeah. So when when we look at these fast food and the design of our community, someone said yes to that, and we have to hold people accountable as to why they're saying yes. And how do we change that? How do we put that power back into folks' hands? And we do this through our praxis. I talked about education, is sharing that knowledge, connecting folks with professionals, connecting folks with the grandmas, because the grandmas are also professionals. They hold stories. And right here, this is my community. These are my cousins. These are my friends. These are people who live in homes right next to a power plant that would burn coal for years and years and years. But it's also that connection, right? Is it only affecting my community, or is it affecting somewhere else? So the coal that the Tucson Electric Power Plant would get comes from the Dene land up north, and they're without clean water. My community is without clean air. So we're connected just like a web. And by putting this knowledge into people's hands, into our community's hands, they become the experts. They get to say, this is what needs to happen. This is what needs to change. And with this, we won the fight. So they're going to stop burning coal. Now they're moving to natural gas. But the ultimate fight is like, how do we get them to go to full solar? And the way I talk to it about with my community is we're the people of the sun. Throughout history, people have known us as the people of the sun. So how is it that we do not have access to solar power? Where does that come in? Where does that role come into this? And it's holding our people accountable, right? We have these sessions where people come into our community, talk about, like, we're gonna do this and do this and do that, and it's like, we've included you, we checked off a box, and we're tired of being that box you check off. You're not coming into our community to ask us what you're gonna do or what we would like to see. You're coming in here to tell us what you're gonna do, and just check off a box to make sure that we're okay with it. And when we're not, nothing happens, nothing's done about that. And this all ties into that food insecurity, because the communities that we find and work in the most are the ones who are the most food insecure. They're the ones who are going to be impacted by climate change at the highest. So with our praxis, addressing climate change is as simple as planting a tree. Because when you plant a tree, you're addressing habitat, you're addressing environment, you're addressing access. But yet, when it comes to those access into those resources, they're always missing. There's no funding to plant trees in your community. If we plant trees in your community, no one's going to take care of them. So it's our job to take care of them. It's our job to show people how to do this. And when we do this, people always want to swoop in for the credit, but it's no. It's like, you sit down with us at the table. This is what we need. This is what we need to develop. And this is how you're going to do it. And with this too, like in Tucson, just for a little bit of context, we have a a rainwater harvesting rebate program, but it's a reimbursement. So I don't know, in my community, we don't have $2,000 to just give out of our pocket and then wait a month to get them back. So our communities of color are subsidizing affluent communities to green their space, to address climate change while we're being left behind. But yet our money is being used to fund those projects. So we need to take it back. We need to just take it back, take a step back, and let people know, like, this is possible. We need to shape what our community looks like, what our political process looks like. And that's how we do it, is by developing those leaders, changing it up, and taking control of what that looks like. And just to share a little bit of stories, like, as to why does this matter? Why should we care? Why should I care about developing leaders? Why should I care about developing my community, our grandmas, our moms, our aunts, our dads, our uncles? Like, why does that matter? And I think it really has to come down to experience. And what is that experience? What does it look like? And how do you create that empathy for folks to join the fight? And it's through storytelling. The biggest practice any community organizer can have is that storytelling piece. So how do you tell your story? How do you get people to know to join you? And to share with you, I am a migrant by ways of, my mom is from Oaxaca. She traveled up, escaping poverty, escaping patriarchy, escaping the lack of opportunity. So when she came over here, she had me on the border. I was born in Nogales, Sonora. My mom worked in a maquiladora, which is basically a modern day plantation with low wages. And this was in the 80s. And she would build, she would put together like AC units for the Corvettes. And she's never even been in one. And when she brought me over to Tucson, I was 2 years old. So I went to elementary school, and that's where I learned choppy English. I went to middle school, I learned my colors. And in high school, I made gangbanging a career. And counselors would never invite me into their office to talk about my future. So it was like my future was already decided for me. The same way the future of my community has already been decided when we look at city budgets, when we look at city development projects. Our community design has already been created. Someone said this community deserves cash time, payday loans, those institutions that hurt us and keep us poor. Someone said this community deserves grade D food. So when you go to affluent communities, you got organic. When you go to my community, we got food that's like rotting, and my mom and I'm fighting with other people's moms to get the best looking tomato. And we think we have a choice, but yet that choice was already made for us. Someone said, this is the nutritional value that you deserve. And with that, through my transformation, growing up in this environment of thinking that I had a choice and control, at the age of 18, I lost my best friend. And that was a real reality check. And that's when I had to really look back and reflect and see, like, what do I want to do? How do I want to change the world? How do I want to change myself? Is this what I want, to see my mom cry the same way my best friend's mom cried? Do I want that for my mom? She struggled so much to get me here. So from there, I stumbled across an organization in my community who was doing gardening work, who was addressing food insecurity, who was addressing nutrition, who was addressing, GMO and climate change at the time, before we even knew what climate change really was in our vocabulary. And as I put my hand into the dark, cool soil, planting these seeds, I learned that I was burying my trauma that I didn't even know I had. And when I got that responsibility of taking care of chilies, taking care of corn, It's a reconnection to culture. It's a reconnection to who we are. And that is stewardships of the land. If we want to take control of our health and well-being, we have to tie back into the land. And that's where my journey began as an environmental justice organizer, finding a bigger enemy. It wasn't the kids down the block. It was TP, it was Border Patrol, it was police, it was the liquor store owners, it was the fast food owners who were harming my community, taking money out of our pockets, taking wealth out of our hands, and taking our opportunity away, because programs never came to my community. I've had university, program managers and coordinators come to me and want to partner, and they say, we can't go to those schools because they're out of our reach. I'm one of those kids that was out of reach. Now only imagine how far I would have gone if I would have had that opportunity. So my message to y'all is, we got to keep growing, connect people back to culture, connect people back to land, because if we're going to win our fight against climate change, against hunger, and against nutrition, not against nutrition, against malnutrition, we have to connect back to who we are, and we have to be warriors for our people, and we have to keep growing and learning and sharing what we learn. So that's who I am. So thank you for listening, sharing. If you have any questions, I'm an open book, and I appreciate y'all's time.
Thank you so much. Gangs to Gardens, what an influential message. And my mother is Indigenous, and her lineage is a similar story of migration. And I really felt that cultural displacement you described. So thank you for sharing your story and being such a power of transformation in your community, really. Next up, we have nutrition and equity. So Miss Teresa Turner is a registered dietitian, school nutrition specialist, fighter for justice, hugger of trees, an alumna of Tuskegee University, focused on child nutrition, nutrition education, and social justice, especially regarding food system inequity. She makes the connections between these areas of expertise and climate change. Welcome.
Thank you so much. I'm going to do a screen share myself. So everybody can see that. I hope everyone's having a great day today. I'm just going to hop right in. I have a few brief slides. Okay, so I'm hopping right into Maslow's hierarchy of needs. When we talk about the link between nutrition and we talk about climate change, we have to think of what basically a human needs and what basically a human deserves so that they can get to the next step. If you look at the very bottom, the foundation of this pyramid, what everything else is built upon, everything in here is directly related to climate. You have air, water, food, shelter, sleep, clothing, reproduction. All of those things are impacted by our environment and climate. So if you have a situation where you have marginalized groups or you have people who don't have access to things, it's exacerbated by lack of equity in climate and climate injustice and environmental injustice. And they can't even look into further things like their safety or love and belonging or making the best of themselves and being all they can be if they don't have the basic things and the basic environment. So let's talk a little bit more about environment. Social determinants of health. We've heard a lot about this, especially recently, and we're going to keep hearing about it because it truly, the word determinant is truly what it means. Your health is determined by your social environment. It's not just determined by your choices. I know personal choices that people go into that a lot. If people just did better, or people just shopped better or ate better or exercised more, that everything will be okay. And they fail to account for all of the other things outside of a person. And you'll hear me say probably more than once, more than twice, that we do not live in a vacuum. That is one of my most favorite things to get people to understand, that every single aspect of our lives is interrelated. So you can make the best decisions that you want, but if you don't have an economic stability, to pay for things that will enforce your decisions, then you're not going to move the needle. You can work as hard as you can, but if you're in a neighborhood or environment that is cruel to you, or that is traumatic to you, or that doesn't provide you the things that you need to succeed, then you can make all the good choices in the world and it won't make a difference. A saying that I heard a quote a couple of months ago, and I don't remember who said it. I wish I could, but it said, "You didn't make good choices, you had good choices." And that really stuck with me, because if you are pulling out of a pot and one person's pot has 3 things to choose from and another person's pot has 100, you can't say that they both have the same opportunity to do well, because that's not being honest. So if we look at all the things that go into, including climate, that goes into a person, we have to be honest about what that means. And so I work with child nutrition. I work with children. I feed children. It's the most important thing to me. I love doing that. It's something that I find is relevant for the simple fact that when we talk about choices, children don't have as many as other people. Children they don't work. They don't decide where they live. Their parents do, or their guardian does, or society does. It's not on the children. Children don't have that type of autonomy. So they deserve the utmost protection. Children didn't ask to be here. And I say that a lot as well, because people think about all these decisions and all the things they ask of adults, but think about the children who have to depend upon adults for all of their life until they are old enough to take care of themselves. So this slide, it doesn't have to do with climate, but I think it's interrelated because, as I said, we don't live in a vacuum. This is a slide that I talk about a lot as far as food desert versus food apartheid. A desert, by definition, is something that's naturally occurring. Deserts, nobody made them, nobody put them there, nobody built them, they're just part of the earth. And so when we look at food insecurity or food security, and we look at the word desert, we automatically are programmed to go into a mindset, because words have meaning. We're programmed to go into a mindset of, oh, this is natural. This is just what it is. These are just neighborhoods that simply don't have healthy food, and that's how they're supposed to be. I live in Maryland now, but I'm from St. Louis, Missouri. And an ongoing joke when we were children is that every street corner in the major parts of the city of St. Louis had a liquor store, a church, a beauty supply store, and a fast food establishment. Every major corner. It was just like something you noticed growing up. And looking back on it, it was funny when we were kids, but it's not as funny now doing what I do. It's not done as a desert. It's not just naturally occurring. These neighborhoods didn't just pop up with no healthy food, didn't just pop up with no ways for healthy recreation. It's done intentionally. It's done through redlining. It's done through poor political representation. It's done through injustices. It's done through systemic racism. All of these food deserts, as they call them, are really food apartheid that are intentionally put here to keep Black and Brown communities and to keep marginalized and low socioeconomic status communities that way. So to bridge the gap, you can't put a Band-Aid on that. You have to recognize it for what it is. You can't look at it as a naturally occurring thing that we just have to cope with and do the best we can. We have to look at it as an intentional division between health and people, and do something to break that cycle so that people can have what they need and the deserts decimate, and there's nothing left of those, and there's food access for everyone everywhere, because we all deserve that. And so lastly, this is my last slide, but I'm going to go into, we look at this slide, and this is from the FAO, and I love it because the part that says those that are least able to cope will be affected the most. And I always go back to children. Children have to stick with whatever is around them and have to deal with whatever they're given until they're able to make a way for themselves. So if we start them off already being hit on one side by injustices due to racism, and then on another side, injustices due to climate change, then we have quite a mess that we really need to bridge the gap and work on. And then it's also which came first, the chicken or the egg. They both impact each other. Like the food system and running the food system inequitably affects the climate. And because you're not able to build up a healthy group of people to make a difference in the future. Because when people talk about climate change, they see the changes now, but they also talk about what it'll be in 2030, what it'll be in 2050. How long can we have X amount of years until this happens, until we no longer have this resource, until this runs out? Who's going to take care of us but children? They are the future. Like people cycle. That's how generations work. So if we're not feeding children now, if we're not setting children up with the information and the health that they need to be on the forefront, to be working on these issues, to be the title and names of these issues in 20, 30, 40, 50 years, then we'll never be able to reach a point where we can make things better. And marginalized groups and children are always going to be most impacted by things like climate change. And climate absolutely impacts crops, impacts harvests, impacts water. We think about Flint, Michigan, and their lack of clean water. It's all of that goes into. And so the lack of climate attention impacts the food system, and the food system being impacted eliminates some opportunities for children to grow up and to be healthy and to work on these things to make the climate better. So it all goes hand in hand. It all has to be focused on hand in hand. And I do have one more slide. Just what I like to end with is one of my favorite quotes. If you have knowledge, let others light their candles in it. Because if you're in a dark room and you're the only one with a candle and you light everyone else's candle, the room gets lighter, it doesn't get darker, and your candle never goes out, it continues to burn. And that's what knowledge should be. And so when I come to these types of talks, these conferences, these panels, and I think about all the knowledge, like the person who spoke before me, my Lanta, it was just quite amazing. I haven't heard anything that good in a minute, and I enjoyed it thoroughly. And I think about the knowledge that he shared, and that is how knowledge should be. We should be able to light up the world with these things we know about nutrition, injustice, climate change, the needs that we have, and then move forward with that and do better for everyone, especially our children. Thank you so much.
Wow, thank you so much for that presentation. I have so many quotes I could quote you, but I was like typing down everything. I think one of my favorites is every single aspect of our lives are interrelated, and you didn't make good choices, you had good choices. That's definitely going to stick with me, especially when seeing patients in the future and looking at their determinants of health. So thank you so much for that. That was amazing. All right, you all. So now we'll take a break from now until 9:50, 9:55. So get up, stretch your legs, get your blood moving, and then we'll see you after that for a panel discussion.
they can hear us. No, you want to be muted.
Okay, everyone, I hope you're meandering your way back. So next, we will have a panel discussion on nutrition. So this panel is facilitated by Bastyr faculty member Mary Purdy, integrative eco-dietitian and adjunct faculty. She's a well-known speaker on nutrition and climate change, whose work includes the presentation, Saving the Planet with Your Fork.
Thank you so much, Jacqueline. It's my honor and privilege to be here. I'm so humbled to be among such incredible speakers today and yesterday as well. So thank you for having me. So let's talk about food. Let's talk about nutrition. So food, it nourishes, or it should, it's supposed to. It feeds us, it connects us to our culture, community, land, environment. And we also know that it's a really, really complex issue in terms of equity and land access and health disparities. I think many people are not aware of the fact that our food system is currently responsible for at least 1/3 of our greenhouse gases. And as Teresa was already saying, and Claudia was saying, climate change is actually having an impact on our food supply and will continue to have that impact, not just on the supply, but also on the quality of the food because of our current industrial agricultural practices. So we're in trouble. Now, I also want to acknowledge that I am a privileged white woman, and I have had food access for healthy food pretty much my entire life. I live now within a 1-mile radius of at least 5 grocery stores, 2 of which are natural health food stores, 1 of which is Whole Foods, and a farmer's market. So I know I don't have all the answers, but what I do know is that our food system needs to shift, and that it is imperative to center the voices of BIPOC communities and marginalized communities so that we are working with them and looking to them for solutions, and that they need to be at the table. So we need to include them in this conversation around sustainable food systems. And when I say that word sustainable, it is not just about the environment anymore, right? It's not just about planting a tree. It truly has to be, that's one pillar, the environmental pillar, one dimension of making sure we are within our planetary health boundaries. But we also need to look, when I say sustainability, the word needs to encompass also another pillar of human health. So creating nutritious food that is accessible to all people. The third pillar of sustainability is economic health. Are we providing fair wages? And are we making sure food is affordable? And then lastly, the last pillar is sociocultural health. So are we focusing on racial equity, animal welfare, farm worker welfare, and creating a food system that's culturally appropriate and also respectful of Indigenous practices? So where does this human health meet racial justice, meet environmental justice, meet climate justice? I would say one central place is the food system, and nutrition is at the heart of much of that. So I'm really pleased to have our 4 panelists with us today. Many of you may have already seen the fantastic presentations of Teresa Turner, who is an Army Child and Youth Services nutritionist who manages the food service operation of 6 child and youth programs, as well as Claudio Rodriguez, who is an environmental justice organizer in Tucson, Arizona, creating opportunities for green infrastructure in marginalized communities, including a school garden program. We also have with us on the panel, Fernanda Brusamolin, who is a core faculty and chair of the nutrition department at Bastyr University in California. And we have Daphne Altima Johnson, who has focused on diet-related illnesses among vulnerable and low-income populations. And she works at the Food Communities and Public Health Program at the Johns Hopkins Center for a Livable Future. What an incredible lineup, so amazing. I feel so humbled to be amidst you all. And you all come from such different backgrounds. I want us to understand some of these issues that we've been talking about a bit better from your perspectives. So starting with you, with Fernanda and Daphne, since you haven't had a chance to speak quite yet, who is being most affected by the lack of equity, the lack of resilience, and the lack of sustainability in our food system? And what are the reasons behind that? So Daphne, let's start with you.
Oh, okay. Well, thank you. Thank you for the opportunity, Mary. First of all, I have to say, Teresa and Claudio, oh my gosh, what amazing. it's awesome to be on a panel with people who have experienced some of the issues, who have personal convictions about what's going on. So that just, you guys tickled me fancy. So thank you for that. That just was so much joy to my heart. So who are most affected? Usually, I will say that when the IPCC report came about, that they know that, as you stated, that climate change exacerbates inequalities, right? And it affects socially and geographically disadvantaged people, right? And those people are low-income communities, rural communities, indigenous communities, communities of color, African-American communities. And so those are affected because, as we know, there are infrastructures in place that are intentionally, as I love when she said that, they're intentionally were in place, for those things to happen. They are disadvantaged for a reason. It's not by accident, right? And so, and how are they happening? Well, you look at low-income communities, their lack of resources to relocate, i.e. Katrina, right? They can't relocate, or when they did relocate, they couldn't come back to their home. Their food prices, when you have droughts, when you have heat, whatever it is, as we see with COVID, people are just running around the stores to get food. And what happens? You have an increase in demand, food prices go up as a result of climate change. These people cannot afford food. So you have rural communities that typically have higher poverty and unemployment rates, right? They are more vulnerable. In those rural communities at times is where what are located? The farms. And, so that has a trickle down effect. You have Black communities. There was a report I read by the Congressional Black Caucus as I was preparing for this. And it just talks about how Blacks, we are less responsible for climate change, right? We emit fewer greenhouse gases than the national average, but yet the decisions that are being made are actually made to negatively impact us, right? So when you look at some of the things that are happening right now and who are affected, usually those that are empowered to make decisions are not the ones that look like the communities that they are affecting. Mm-hmm. And that present an issue. And I'll stop there because I think eventually we're going to you and I talk about, well, what can we do? And I'll talk about some of the things we can do with, to bring it all up, full circle, hopefully, but we have a lot of ways to go.
Absolutely. Solutions are going to be a key part of this conversation, but starting with some of the issues and understanding them is always helpful too. So thank you, Daphne. Fernanda, how about you?
Wow, thank you guys. This has already been so inspiring. And so just a little bit from my perspective. So I was born and I grew up in Brazil, southern Brazil, where, our diet is meat with a side of something, usually a side of beans seasoned with some meat, right? So that was a perfectly fine diet growing up, 30, 40 years ago. And what happened is we see as third world countries start to industrialize, right? There is a huge shift in the way that the population accesses foods as well. So we see that, growing up in southern Brazil, meat is a big part of the diet. However, when you see how the industry evolves, it's a very different way in which people are consuming that meat right now, and a very different way in which this meat is coming from and how it's being processed. So now we know that there's great losses in indigenous forests from the Amazon, right? Because we need pasture, we need to grow grains to feed all of these animals. So just a little bit of a different a bigger perspective from where I come from. And then so that led me to look into, okay, so diets, right? There's got to be some just to do with diet from the consumer's end. So I went out and I studied plant-based diets and all of the effects that they do, and that's all great. And I made an intervention and I got some good results. And then what? right? So I think that that's what do we do? Okay, so I know that, yes, we can decrease animal consumption by teaching people how to cook, tempeh and tofu and all of these wonderful things. But I am still not reaching the people that are most affected by the diet-related chronic diseases. I'm still not doing anything to help, promote those communities and their, like Claudia was saying, like, give them the power to do something for themselves. So, my point of view is, as a nutrition professional, as the nutrition profession, we need to do something in terms of, what the guidelines tell us and how do we conciliate with that. And I think we have a responsibility to educate our students and educate our community that the plug and play, the do this and be healthy approach, as Teresa brilliantly told in her presentation, right? We can't follow that anymore. We can't tell people you just eat this, this, and this in these balance, and we pretend that this is going to make you healthy, because there are so many other determinants that we are missing the point. So I feel like we are in a crucial point in our profession as, nutrition and dietitians. And I'm like you, Mary, I don't have the answers, but I just know that, what we're doing is not working. And I'm worried, I'm very worried that we're actually making the problem bigger by making dietary recommendations so elitist, right? And going back to the whole, I'm thinking about, like, the whole salmon conversation we heard from Darrow yesterday, from the salmon people. We make, oh yeah, now everybody's supposed to eat salmon 3 times a day because salmon is such a great source of, omega-3s. And we're making this so elitist that we are not only still not reaching the population that most desperately need help with, preventing chronic disease, but now we shifted the source of, something much deeper, something almost spiritual, to communities that depended on it for, centuries. And we are promoting an industry that now putting out products that are lower in nutritional quality and contributing to environmental effects, and we're still not missing, we're still missing the target here. So
absolutely. I think the situation is much greater than just having that garden burger in place of a burger. So I want to move on to a different question, and asking Claudia and Teresa this question too, which is our current industrial food and agricultural system as is. I'm curious from your perspective, what impact this is having on the environment, whether it's your environment specifically or the environment in general, and how that is affecting specifically human health.
Thank you, I'll go. So we looked at, I'm going back to the hierarchy of needs for a reason. It's impacting the environment because when people don't have their basic needs met, it's difficult to focus on things outside of yourself. We talk about, this is something that takes action from everybody. This is something that one person can't do, 2 people can't do. The world has to be on board to positively impact climate change. So if you have an entire group of people, a marginalized group, who don't know where their next meal is coming from, then they're not concerned about recycling. They're not, that's the last thing on their mind. It's not because they're horrible people who don't care, it's just because they're hungry. So that automatically impacts the environment. And then on top of that, on top of the fact that they're hungry, we think of, this might seem like a reach to some people, but you have to think of all aspects and think of when you push a domino over and it's a whole bunch of dominoes and they can spread off in all different directions. Think about waste and using material waste. When people don't have healthy food education or people don't know how to get healthy food, they go to fast food places. That's the bags, the styrofoams, the plastic, all the things that are going in the trash and going into landfill. And if they had more opportunity for healthier options and more opportunities for sustainable options, then they wouldn't contribute as much to these issues. And it's all interrelated. It's nothing in a vacuum. And so I believe that not having basic needs met and pushing people into a corner to make unsound or unhealthy decisions further exacerbates the issues of climate and environmental issues.
I see a lot of nodding here. Claudia?
Yeah, no, I think that's beautiful. Thank you, Teresa. And I think a part of it too is access, but it's also where are these food production systems placed? Where are these production factories placed, right? When you look at the meat processing plants, majority of them are operated and ran by migrants, by people of color, but yet the communities around them are composed of people of color. So when we talk about, our impact, and, I'm Mexican right here, like carne asadas, like grilled beef every Sunday, that's like a thing. But if we're really if I'm really going to incorporate and bring my people back into it, is having that conversation, is our consumption is impacting our brothers and sisters who live in the Midwest, who live near these plants, near these egg plants. And also a part of that is the soil runoff. Like we're composed of soil, we're made of soil. What the nutritional value of what's in the soil is what's going to be in your food. And we are depleting it by using fertilizers, by monocropping, and we need to change that practice. And I think I want to go back to that connection to land. Is if we start building up more local farms, more community gardens, connecting people to it, because when you look at history of communities, you'll always find that there was gardens in every backyard, and it was only until the industrialization that started to change. And I also think it's the practice of distribution. I think that also impacts our health the same way that y'all have mentioned. It's how our communities are designed. So we have to be able to redesign them in order to change the impacts of that health, of those determinants, that cause us to do that. So it's a long fight, but I think that's why we're here.
Definitely. And Claudia, let me ask you a question specifically. There are a number of organizations and movements that are calls to action that are working to center the voices of Indigenous people, of BIPOC communities when addressing these issues of climate change, especially as it relates to our food system, as our agricultural system, as you were just saying. What does that look like to you in your mind, that centering of Indigenous and BIPOC voices as we take steps to get to a more sustainable system?
Oh, I love this question because these are my demands. And I think it's really looking at budgets, because I work for a food bank, I work for a community food bank, and we distribute food. And it's really looking at the root causes. Like, are we really addressing the problem of hunger? Or are we being poverty pimps and just building on wealth of people who are poor? Because we're in business because people are poor. So I go up to my CEO and we talk about, what does our budget look like? If we're going to be giving out grants, we need to be giving grants out with no strings attached. We have to trust our communities that they're going to do right by spending it the way that they need to spend it, because they know they're at the front lines of this work. They're at the front lines of these issues, and we have to be able to put in trust with that. Along with that too is what is our board made out of? Does our board include youth, people of color, Black and Indigenous people who are affected by this? And like right now, like with Black Lives Matter, with Stop Asian Hate, with the stuff that's going on in Palestine, with police brutality and all these things, you have all these organizations, all these institutions putting out messages about equity and social justice. And my challenge to them is, show me your board, show me your budget, and I'll tell you where your values lie. And if you don't change them, then you're not about it. You're just about the clout, and you just want to get like on that board because it's trendy. And I think one thing too is to add to that, to center this work, we need to do DEI work, but that includes justice work to that, because all we're doing with DEI, with DEI means diversity, equity, and inclusion, is we're just showing people the vocabulary, but we're not changing praxis. You can have a whole organization that knows about DEI, but if you don't change praxis and practice and change your principles and values, you're not going to change the world. You're just going to update your model. And that's my challenge to all organizations and to all industry, is to really look at that. If you want to center that voice, pass the mic. Don't talk for us. Pass that mic.
Nice. Thank you. And Daphne, let me turn it over to you, because you are working in a public health space. You've worked in public health, you have that perspective. So how do you see community organizations and policy actually playing a role in changing this conversation?
Yeah, I think everyone has said those solutions, but I'm just going to take a step back to kind of connect it, like hopefully in a way that makes sense. But the health effects of climate change, right, worsen those issues, those social determinants of health, healthy housing, access to health care, food affordability. But what makes low-income and communities of color more vulnerable is the issues that they continue to face, right? Those issues are structural racism, inadequate infrastructure, health disparities, as you said, Claudia, language barriers, less resources, right? And I can't evacuate. And it leads to all those trickle-down effects, right? Food insecurities, physical damage to communities, and emotional damage, right? Let's not forget about the mental health. This is huge. Trauma is a thing for communities of color, all communities, vulnerable communities. And these issues, right? So you look at COVID, you have obesity, diabetes, respiratory disease, and this is all diet-related issues now. And so what we know is that it starts with people's living conditions, which is what I think Claudia was hinting to, is that your living condition, I saw this quote somewhere, the color of our skin in America and our economic standing determine what food is available to certain groups. That is not okay. It is not okay. And so the question is, so what does community organizations need to do? So those issues I'm talking about, structural racism, so we need to deal with those. We need to deal with, we're talking about funding. There is a lot of money. So we as a country have a history of basically not putting, resources in these countries. So we, and in those communities, so we need to basically, when we have the money, when we have the funding, you show me your board, you show me your budget, then guess what? Put it in it and let us determine where we need. So what else you need to do? Education and training. Study shows that, developing policies that strengthen people's capacity to cope and adapt to climate change is one of the things that's very effective. So we have to engage the community that's been affected. Sometimes they don't know. So, if you have a flooding well, let's just be something more recent, Texas, the power outage, right? They didn't know where to get food. That's simple. So we need to do that. So we have to go, we have to look at these populations and teach them not only how to adapt to the changing environment, but how to thrive, right? And that is going to have to do with education. And one thing I know Isaac is going to talk about later that I'm passionate about, because I have a history in epidemiology, surveillance data and evaluation. People, policies, you cannot change policies sometimes. Some people are so disconnected to what the communities are going to, that you need to tell them that personal story that Claudia tells you. You need to show the pictures that Teresa tells you about. You need to hear that personal narrative. So that qualitative data needs to go with that quantitative data. So that's gonna inform your community organizations and your policymakers to prioritize action and assess if those interventions are working. I can't say that enough. And from a food perspective, subsidies for McDonald's, liquor store, again, not okay, right? How about subsidies for health food retail options? Like you said, you have to, I'm fortunate enough, privileged, where I have a Whole Foods, I have other options, but that's not the story of many that looks like me, right? So why not give subsidies to those organizations? Why not support community gardens? And we have to start at home. I am with you, Teresa. My children, they know the joy in their eyes when they grow something. If it's cucumbers, or we're doing squash right now, and they can cook it. When I tell you that make this mommy happy, you have to show them at a young age, right? So the whole idea for me is building that generational knowledge. So my hope is they can pass it on to their friends, to their, to their children, whatever that looks like. And also we have to, another thing that I'm learning, I'm doing is vulnerable populations as it relates to the jail system. When I tell you the food that is available and at those institutions, schools, like jails, hospitals, it's crap. I don't know how to put it, but it's crap. So we have to work with those institutions, right, that serve those vulnerable populations to create policies where they're buying good quality foods. That's a thing. And we have to change those procurement practices. We can do that. And so I think if we don't really we have to use the community to frame the solutions. We have to empower them because they know it's happening to them. So you can have me, but I don't live in that, right? So I wouldn't know. And I think that's very important. That's a role community organizations can play.
And I want to thank you, Daphne, for that, for just fantastic perspective. And Johns Hopkins Center for a Livable Future is such an amazing resource for anybody who wants more information about these topics. And Daphne's obviously a great resource as well. I want to also talk about the nutritional component here. Teresa and Fernanda are both nutrition educators, are both in the world of nutrition education and dietary guidelines and recommendations. I'm curious also from your perspective, where does the nutritional piece come in here in terms of the food that's being produced, whether it's healthy, who it's healthy for, who has access to it? What role does nutritional guidance and play in this discussion around climate change and food equity?
Sure, I can chime in, and then Teresa, please complete my thoughts. But I think that I want to start by saying that I think guidelines are important, right? We need guidelines. We need to know what to eat and what to base something on. The issue I think that we face is that the way that the guidelines are come to be in this country are questionable, right? It's a case of follow the money. It's a case of following the influence and follow the power. So when you have guidelines that are heavily lobbied by the dairy industry and the meat industry and the industrial agriculture, we end up with a very important piece of document that informs very important programs that then determine what our population is eating. So our dietary guidelines inform the school nutrition program, informs our military meal programs, informs our prison programs. So we are based on guidelines that we know we can still meet those guidelines with, like Daphne said, with crappy food. Right. And that's not okay. That should not be acceptable. Right. I can still have, dietitians like, some of us here signing off on menus and, big fast food restaurants and proving that, yes, you can be healthy. You can follow these guidelines and, do as I say, and you will be healthy. But, not telling us the whole picture. So when the biggest document that we have to inform nutrition education is based on not the health and well-being of our population and our environment, but on influences of the industries, then we have a problem. So yes, we need guidelines, but the guidelines that we have right now, unfortunately, are not what we need them to be. So I want to give my colleagues some time to chime in.
Well, first I want to say, Fernanda and I have never spoken, but somehow she hopped in my head with that statement about follow the money. I was like, how did you know where I was going? So anyway, we talk about climate, that's a C word, but we're going to talk about another C word, capitalism. When the purpose of the food system is profit and it's no longer nutrition, we're already in trouble. Mm-hmm. The purpose of food is to nourish bodies. It should never, ever have been about making a buck, but that's what it has become. And that's the main goal. And that's the root of many of these problems. It's if you can't afford A, B, and C, then you don't deserve A, B, and C. When you deserve food, no matter what you can afford. And my camera freezes. I apologize about that. So that's something that I really want people to understand and be honest about that. And when we talk about the dietary guidelines, another quote, I love quotes. You'll hear me throw out quotes. I love those. The best way to right wrongs is to shine the light of truth upon them. It's probably not an exact quote, but a lot of people don't want to dig into what capitalism really means and what it really does and the harm that it really does cause. People want to talk about free market and the wonderful things about it, but it's only a free market if you can buy into the free market. Only if you can afford to participate is it a free market. They left that part out. Like everybody can participate. No, only people with money can participate. And so then people with money get more money for participating, and people who don't have any money never get to make money because they couldn't buy in to participate in the first place. And so we talk about the guidelines. The guidelines are made by people whose heart are likely, I'm sure, in the right place. They're made by nutrition professionals like myself, dietitians like myself. We absolutely care when we put those guidelines together, but it's also with the lens of capitalism. It's always going to have that backbone of money and profit. And we have to get away from that And also into that, we talk about diet culture and fat phobia, and that all ties into as well. The purpose of the guidelines has really been geared towards obesity prevention. When obesity is determined by all sorts of things, and that's muddied, and how that all started, and BMI, and how that goes into supremacist culture and racism from back in the day, it's all built in. The purpose of guidelines should be health, not making people thinner. It shouldn't be profit. It shouldn't be making people thinner. It should be nutritional well-being for everyone. And until we admit that it's not, then we can't fix the issue.
Amen. Thank you, Teresa. We've been identifying so many problems, and I want to focus on solutions because we want to leave today feeling like, okay, this is what we can do. This is what we can see our communities doing. So I want to ask you all, what does a sustainable food system look like to you? And how can we begin to get there, even if it's just a few baby steps? Claudia, why don't we start with you? I know you got ideas.
All right, cool. What would it look like for me? To be honest with y'all, I think it has to go down to sovereignty. You know, every community should be responsible and should have the power to choose how they want to be fed, the nutritional value they want, but also helping folks to dream that opportunity. Because in my work, you know, we've only been taught to dream so far. And once we get to that dream, like our dream is like what we have is what we have and that's it. But we're not taught to dream further than that, to go beyond that. And I feel like we could already have a sustainable food system. The problem is the distribution. The problem is the practice, and that has to do with what Teresa said, you know, capitalism. You know, as long as there's a price to that, my community is always going to be poor. It's always going to be disproportionate. It's always going to be underserved. And you know, I think one of my goals for that is recently I've been quoting George Jackson, and I think the time is now for us as professionals, as nutritionists, as organizers, as people in institutions to take his quote to heart. Or one of the things that he said was I've been patient, but where I'm concerned, patience has its limits. Take it too far and it's cowardice. And I think we're just waiting. We're just waiting and waiting for a change to happen. But we're that change, and the youth are that change. And we have to organize, mobilize, and get people to those spaces. Because if you're not at the table, you're on the menu.
Mm-hmm.
Thank you.
Thank you. Fernanda, how about you?
Well, I think that we need to be champions to allow people to make, to give them the ability to make informed decisions, right? So give the power to the people to make their own informed decisions. And, you know, from a very microcosm perspective, I would say, you know, grow some food, cook some food from scratch, right? Starts in your kitchen. That's like a rebellious act that we can all do. Like, you know, say, just do your own thing. Grow your little green onions from the roots and start there.
Excellent. Daphne, what does a sustainable food system look like to you, and what are some steps we might take to get there?
Man, you know, it's one that everyone, you know, we hear, you know, we know what a sustainable diet is, but an equitable food system is just, in my heart of heart, is one that's everyone, including those that are most vulnerable, right? Low income communities of color have the resources, the education, and everything that they need to nourish and prosper and benefit, right? And then if they don't have that, then from an equity, not equality, from equity's perspective, what do you have to do to have all this group be at the same level? Because some starts here, some start there, some already there. So what needs to be done? And to know that we have to be okay with some people not really having to rise up because they already are at that level. It's a system that we have access to healthy, affordable, you know, culturally appropriate food is a thing for me. When I was in my dietetic program, I just remember, you know, listening and seeing, you know, some others doing nutrition education and nutrition counseling, and they were just, it was very judgmental and the way it was doing. But it's because we live in a society that taught us that, you know, we have to look a certain way, we have to act a certain way. We are so brainwashed into that. So we actually has to get rid of all that thought and create a framework that where all of us can benefit from and nourish. So I think so. I think that, and it's not a one person, it's not a one group problem. It's not a Black problem, a white problem. It's an all of us problem, right? Because when one do well, all of us will do well, right? It's a thing. And that's what we have to do. There is no reason why little babies should be skipping meals, which is what we're seeing. Like, that's not okay. So we have to really heighten that and make it possible. And it's all of us have to be involved. All of us have to do it.
Wonderful. And Teresa, how about you? What does a sustainable food system look like in your eyes? And how can we start to get there?
Definitely took a walk in my head too, I guess. I was like, how is this happening? I love it. Truth, telling the truth. So what to me, first and foremost, what a sustainable food system looks like is no child hungry, not a single hungry child, period. Not a hungry person, but especially a hungry child, because they are the ones who deserve the protection because they didn't ask to be here. They didn't choose to be here. Somebody brought them here. And so they need to be taken care of, because that's our obligation as adults who make our choices. And telling the truth and honesty is the way. When people talk about crimes against humanity, they think about things like wars and bombings and imprisonment falsely and all sorts of things like that, but they don't consider having a billionaire or a couple of billionaires or however many living on the same continent as a child who hasn't had a hot meal in a week. And they don't consider that a crime against humanity. I assure you it is. And it's allowed to happen. It seems to like it seems to be batting an eye that this is occurring. And I can't, that is inhumanity. That should not even be an existence. And that is a result of capitalism. There has to be a way. And then people say things like, well, they earned their money. There is not enough time on earth. Nobody is alive long enough to earn any amount of billions of dollars. That's not a realistic thing to say. It's not earned. It's gotten by investments. It's gotten by dealings. It's gotten by practices. It's not gotten by earning. And we have to tell the truth about that so that people who don't even have the opportunity to earn, if they want to call it earning, can get in there and get food and get a safe place to live and a safe place to shop and a safe place to exercise and all of those things. So it really looks like telling the truth about what really is and not calling it something it isn't. Not just saying, hey, it's a fair market. They pull themselves up by their bootstraps. They just worked hard and succeeded and everybody else needs to, catch up. That's not true. And people have to tell the truth. And then that way you can solve the issues. And I think that's the way forward. And for people to face the truth once they admit it and to really do what it takes and really do what is right. They make laws for everything else. They make policies for everything else. Claudio said something that really made me think of trusting people to use the money that they're given. I just sung inside, because you talk about over policing and not just physical police, but over monitoring of people. The society has been responsible for the marginalization of people for centuries. And then once somebody finally gets a resource and able to make a difference for their community, you want to say, hold up, what are you doing? Send me this. I need a report. I need a paper. I don't like what you're doing. Like, listen, let me make it. Give me a shot. And instead of giving billionaire shots, you have all the policies in the world to let them continue to go on and make, but you don't have policies in place to keep children from being hungry. Something's wrong. And people need to face that and do something about it.
Okay, everybody needs to see this webinar and this panel and this power that is coming out of each one of you. Thank you for the brilliance here. And I don't know if you're seeing all of the chat comments, but people are really resonating with what you were saying. And I think all of us want to repeat and watch this again so we can continue to unpack everything that you're saying. I want to give each of you an opportunity to share with us how we can support you, how we can find you, how we can be an ally to the work that you are doing. So we just have a couple minutes left to share with us ways that we can continue to keep in touch. So starting with Claudio, if you want.
Yes. The way you can support us, is find a group of youth train them up, let them be the ones that are going to take your place with your ideals, with your values, because we don't get that enough in our public school systems. So just do that, start those small fires in your community, support people in your area. And yeah, just appreciate y'all. Thank you for the opportunity, for allowing me to share. And if you want to follow me on social media, I'm going to put my handle in the chat. And yeah, thank you.
We do want to follow you on social media. Done. Daphne, how about you?
Gosh, that's such a good question. I'm gonna go back. It's so much. It's something as simple as knowing that what you do in your community, as little as it may be to you, is very impactful. I have my neighbor, when everything happened with COVID, she literally went out, and when I tell you, she has about an acre of land and it's nothing but food, fresh food. And she invite all of us to come, let's build, because we have to do that. And that little act she made was so important. It was so impactful, you know, because our children were able to go and help with that, right? And so I think for me, it's look at what you can do within your community, educate and empower. Food is medicine. I know that for a fact. I'm Haitian of Native, so I know it's medicine. And so we have to remember that when we grow little youngs.
I want to make sure we get everyone's voices in here because we're just out of time here. Fernanda, how can we support the work you're doing?
More of this, more conversation, more people at the table, more sharing stories, more voting with our money.
Excellent. Yep. Lastly, Teresa.
Yes, and I put my handle in the chat as well. And I don't do any of this for me. I do it for food insecure people. I grew up food insecure. I didn't even know it until I was old enough to know what it meant. So what you can do to help my work is to make sure you do everything in your power to see to it that you don't know a food insecure child and that they cease to exist. That's what you can do for me.
Yep. Thank you so much to all of you. This was incredible. I want to sit down and have a meal with each one of you and share that experience. Thank you so much for being with us today.
Wow, you know, if this group of panelists ran the country, I think that the entire world would be a better place. So I'll vote for you guys any day. You know, one thing that really stuck out was, you know, I have access to Whole Foods and nutrition stores, but that's not the reality for those that look like me. And that really hit home. You know, being in San Diego, there's Sprouts, Whole Foods, farmers markets, and it's sometimes easy to forget that perspective. So thanks for bringing me back to reality with that. And you know, the conversation's not going to end here. So let's keep having these conversations. Let's keep showing up to conferences like this and keep using your voice, because it's obviously so powerful. All of us have been moved through that panel discussion. So now we'll take a break, a little brunch break, because it's not really breakfast or lunch, but it's our brunch. So please come back at between 11 and 11:05. Again, get up, go outside, eat some nutritious food, and then we'll see you soon. All right, thank you all.
Can you hear me?
Yep.
Good deal.
Yes.
Good.
Thanks.
Good. I feel better. Good. Could add some technical difficulties in my house. So I had to come to my office. That works better.
Wow. Good. Great that you found some solid bandwidth.
Oh yeah. It was kind of scary. I'm like, I just got back and all my internet's down in my house. So I was really glad to have a space to come to. So sometimes it works.
All right, everyone. So I hope you're coming back from your little brunch break. Before we get into our next presentation, I'd like to introduce to you Brian Carroll, who is a second-year student at Bastyr University studying naturopathic medicine and public health. And here he is with a few words from our sponsors.
Thank you all for being here. Once again, we would like to thank all of our contributors and especially our sponsors for making this event possible. North Sound Accountable Community of Health, Bastyr University, Communities of Color Coalition, Seattle 350, the Washington Association of Naturopathic Physicians, and the Naturopathic Alliance. A pioneer in natural medicine, Bastyr University is a nonprofit private university that is at the forefront of developing leaders in natural health, arts, and sciences for the 21st century. Bastyr offers graduate and undergraduate degrees in science-based natural medicine that integrates mind, body, spirit, and nature. The university is also a leader in conducting cutting-edge research in complementary and alternative medicine and in offering affordable natural healthcare services in its local communities. We at Bastyr are pleased to support this conference as part of our commitment to communities, to scientific understanding, and to healing. The Washington Association of Naturopathic Physicians is proud to represent the naturopathic profession in Washington State. As one of the largest state professional associations of naturopathic physicians, the WANP collaborates with and leads the naturopathic community as a whole. They work hard to adhere to their mission of supporting their members and advocating for naturopathic medicine in this state and beyond. They aim to increase public awareness of and access to naturopathic medical services, and they contribute to quality of care through continuing professional education programs. All naturopathic physicians and students in good standing are welcome to join the WANP, as are those in the community who want to support their mission. The WANP is grateful to be part of this incredible conference and looks forward to supporting endeavors like this in the future. Learn more at wanp.org. The Naturopathic Alliance promotes holistic public health and health equity through providing information and education to members of the naturopathic profession and to the public. We seek to nurture the naturopathic community, advocate for equity within the profession, address misinformation, create inclusive educational content, and highlight intersections of social and environmental health and justice. We produce content that examines all aspects required for healthy communities and bring together, support, and promote leaders from marginalized and oppressed groups. The Naturopathic Alliance advocates for equitable access to healthcare for all and encourages evidence-based public health measures. Learn more at naturopathicalliance.org. And thanks to our friends at the Naturopathic Alliance, we do also have 2 gift cards, each valued at $100. Those will go to the lucky recipient of our drawing at the end of the conference. We just ask that you go ahead and at the end of the conference, fill out the post-conference survey. Filling out that survey is your entry to potentially win one of those $100 gift certificates. That's to 8th Generation, a company that supports Indigenous products and empowers those communities. So thank you again to all of our sponsors.
Thank you so much, Brian, for that. And thank you to all of our sponsors again. We couldn't do this without you all. Next up, we have Climate Change and Health Modeling Tool with Dr. Isaac Emery. So Dr. Isaac Emery presents an online instrument for participants to propose climate solutions, such as dietary shifts, energy efficiency, carbon pricing, reducing deforestation, and carbon dioxide removal. These approaches are tested using En-ROADS, so participants can see impacts on global temperature and other factors. Looking at actions from a multi-solving lens opens up conversations about how different climate solutions may help or hinder underrepresented stakeholders and provides a valuable tool for communities. Welcome.
Thanks so much, Jacqueline. And it's a really a pleasure and an honor to be here. Thank you for including me in this really wonderful lineup of speakers for this event. And I hope that we all get a lot out of this. En-ROADS is kind of a science wonky tool, climate modeling tool, but it is one of the best, most interactive and sort of user-friendly ones that I've ever seen. And I think this will be pretty fun. So this is a very interactive session. I will be sharing my screen with the En-ROADS tool on it. But what I really need is input from all of you to tell me what climate solutions you'd like to see me enacted, basically. So I'm just gonna, I think the best way to get started with this is pretty much to jump into the tool. But first, I just want to share, we shared land acknowledgements at the beginning, which I'm really grateful for as well. Here in Seattle, I'm on the traditional lands of the Duwamish tribe. The Duwamish tribe does not, despite being one of the original treaty tribes with the United States, does not have federal recognition. If that's something that speaks to you, please, they do have a petition to our local congressional representatives right now at change.org if you'd like to help encourage that problem to be corrected. I'm very much an advocate for our local tribes. So given that, I will hop right in. Okay, so now that I've shared that, of course, I have to reopen the chat, get everything ready. So we have about 25 or 30 minutes here. So I'll try and describe what this tool is, and I'll be watching the chat for all of your suggestions for how to use it. So there's a lot going on this webpage. It's all right, don't worry about it. It's the same webpage you'll be looking at for the next 20 minutes, so we got lots of time to figure it all out. What this En-ROADS tool does is it takes what society is doing, it takes how we use our natural resources and our energy and our fossil fuels, and it uses that information to see what our likely global warming, our climate change is going to be over the next 100 years, or over the next 80 years, from the year 2000 to the year 2100. So in here on this chart, we have our global sources of energy. This is all of the energy that is used by every person and every company and every human activity around the entire world over the next century. We have energy coming from coal in dark red, energy coming from oil, energy from natural gas, or a new term that I've just heard that I like a lot better, why we call it natural gas. We don't call oil natural oil. Fossil gas would be a much more accurate term for that. We have energy coming from renewables, solar and wind. And of course, we still have energy coming from, pink is bioenergy, which includes everything from ethanol from corn in the United States to fuel from sugarcane in Brazil to burning wood stoves in Asia and Africa and elsewhere. So bioenergy is a really broad topic, broad issue. Nuclear power in here. So this is where we get our energy. We add all that up and all of the other activities, the things that we do with that energy. So if someone, looks like Krista just asked about concrete. We use energy to make concrete. So that's another source of emissions. We add all those up, we get a certain amount of greenhouse gas emissions, and that drives temperature change. So the 2000 to 2020 is actual real measurements that we have from the actual real world. 2020 to 2100 is our best guess at where the world is going to go, what the temperature change is going to be over the next century, given what our governments and our companies have said that we're committed to doing. So what we'll get at the end of this century is about 6.5 degrees Fahrenheit, 3.6 degrees C of climate change. That's really bad. I usually do this in an hour or 90-minute presentation that includes why is 3 degrees bad? Well, it's really bad. So already, right now, today in the year 2021, still can hardly believe it's 2021. It sounds like the future, but we're at 1.3 about degrees of global warming from average, from last century's average. We're already seeing wildfires are worse, hurricanes are worse, farming is harder, temperatures are rising in places around the world, making it harder for people to survive. So we are already seeing the damage from 1 degree, basically, of climate change. And it gets exponentially worse as temperature rises. So the goal of the world, according to the United Nations Climate Agreement, is no more than 2 degrees and try to be less than 1.5 degrees of global warming at the end of this century. So these dotted lines show this is our goal. This is what we hope for at the end of the century in terms of climate change. That's the very quick rundown of what our climate goal is for this. But as we've been talking about for the last couple of days, climate isn't just about temperature. It's about access to resources and it's about health. So one of my favorite things about this is that it also gives us tools to look at what some of those impacts are. They're crude, we're looking at the whole planet, so we're not able to narrow down on 1 or 2 countries or communities, but it gives us an idea of across the world what kind of impacts we're going to see. So the 2 things that I like to look at to give us an idea of those impacts are 1, access to resources. A lot of global development where we are now has to do with what it costs us to get energy. If we think about the cost 300 years ago of lighting a room, you had to pay a substantial fraction of your income for candles if you wanted your room to be lit at night. That cost has gone down spectacularly. Lighting a room is no longer a cost that nearly any of us have to consider. There's a lot of other costs we have to consider, but lighting a room is no longer really one of them. So the cost of energy is a really big deal. Another issue, of course, is health. Air pollution is not the only way that climate impacts our health and that our use of resources impacts our health, but it's a really big one. Millions of deaths a year are due to air pollution. So this is just one of the ways we can think about how our climate solutions affect our health. And we can see, I'm going to bring up that chart of energy use again. We have energy we're using around the world, again, from coal, from oil, from natural gas, from renewables. That use of energy causes us damage, health damage from air pollution. So you can see a huge amount of that is from coal, some oil, some bioenergy. Burning things is bad for our health. As much as I like the smell of a campfire, I know it's bad for me, and it's a lot worse for living near a coal plant. So these are just some of the things we're going to be looking at over the next, I guess we've got 20 minutes now, 15 minutes. So let's go back to looking at our temperature graph. Our goal is to get down under 2 degrees, and we're going to look at how can we get there. So this tool gives us about 20 or so tools to solve climate change. We can change where we get our energy, we can change how we use our resources, and we can change how we use our land. So with that, Yes, thank you, Mary. Mary's seen this before, so I really appreciate her input in the chat. Absolutely. So please jump in. How have you heard, what's a climate solution you like or that people hear about a lot? Excellent. Carbon pricing. Yeah. Okay. Carbon pricing. Do you have, Lev, do you have an idea for a carbon price that you've heard that you think would be a good place to start?
Oh boy, I was going to look up Washington's new bill. I have to look that up, though. I don't have it on my head.
Oh, I don't have, they've proposed a couple. I don't remember that one either. Just for the sake of time. So right now there are carbon markets in a few places around the world. And carbon prices generally range from like $5 to $20 a ton of carbon dioxide. The actual damage to our society from CO2, scientists estimate is closer to $100 to $200 a ton, 50 to 200. Let's just go with 50 for now. All right. So we put in what the model considers a medium carbon price. What did that do? We saw some things change. We get less of our energy from fossil fuels because they emit carbon and are more expensive. Did a carbon price solve climate change? It did not. Did it help? It did. I see some nodding. Great. So this is going to be the real repetitive part of this model. Did it solve? Does any one thing solve climate change? No. Do lots of individual things help? Yes. So this is what we'll see. What's our next solution? I'm looking back at the chat here. Yes, progress, not perfection. We have reducing methane emissions from industrial animal agriculture. Oh, we had end subsidies for fossil fuels before that. Yeah. So putting a carbon price helps offset some of those subsidies, but it doesn't end them. Of course, there isn't one button here for ending all subsidies because they're complicated, but we can basically say, let's tax, putting a tax on something is like the opposite of subsidizing it. So let's tax our fossil fuels a little bit. All right, that made another little bit of a difference. Fuel. So we're gonna go, the next solution was methane from industrial animal agriculture. This is one of my favorite settings. So we've got a bar here for methane and other gases. We've got methane and other gases from agriculture and waste. So that's food waste, that's animal manure, that's cows burping. Cows burp a lot. So let's say we can cut that in half over the next 20 years or so. That helps. We undo that, redo that. So it doesn't change our energy graph, but it changed our temperature graph a bit. That gets us somewhere. Now let's think, actually, so we're gonna jump back a little bit. We looked at the carbon price. That's a popular solution, right? I'm actually gonna bump that up a little bit just because we're kind of low on time. And we taxed, let's highly tax our fossil fuels. So we've got more expensive fossil fuels, we've got a carbon price, that helps our temperature. Climate change is a lot better. We've changed where we get our energy from, a lot more renewables. What have we done? We're thinking about equity here, right? So we're also thinking about access to resources and about health. So access to resources, we're kind of looking at the cost of energy. We really changed the cost of energy. When we put a price on carbon, when we make fossil fuels more expensive, that makes energy more expensive. So we have really changed the cost of getting energy everywhere around the world. So this might potentially be a problem for access. It helps reduce the temperature, which is really, really important, but it potentially creates an access problem. When we look at our health metric, where are we? That looks a lot better. So making it harder to burn fossil fuels makes energy more expensive. It creates a bit of an access problem, but it also reduces our health costs by a lot. So maybe there's a way, we have governments, we have community solutions. Maybe we can balance these out. Maybe lowering our health costs, we can offset some energy costs, but it's something we have to think about, and we have to be conscious of where these problems are coming from and what the impacts of our actions might be. So fighting climate change is really important, but thinking about what are the implications of those our solutions are on access and health is really important. All right. So what other solutions have we seen? Carbon removal, carbon sequestration. That's a really big one. So that's taking carbon out of the air without changing necessarily how much we put in the air, right? So we've got two ways to take carbon out of the air. We can plant trees, or we can build machines to do it. Yeah, so let's look at, Heather Price has a great idea. Let's try trees. So again, one thing I really want to emphasize is everything in this tool is physically possible. So all the bars we're moving back and forth that might be politically challenging, but everything here is technically, feasibly, scientifically possible. So of course, there's a limit to how many trees we can plant. This tool says, well, there's probably an area around the world about the size of India where we could potentially plant some trees. That's a lot. India is a very big country. But let's say we get about 80% of the way there. Oh, let's say, yeah. All right. So we planted about as many trees as we could possibly plant. It helps. If we look at the details on that again, this is how, where, when. So we're looking over the next century. When does that carbon come out? Yeah, it takes trees a long time to grow. And that's part of the trouble with planting trees. It takes a while to plant them, and it takes trees time to grow. Heather also says, let's protect the trees that are already here. Great idea. We can cut trees down a lot faster than it takes them to grow back. So right now, well, we don't need to show all these stuff. Let's slow down our deforestation. That helps again. All right, so planting trees and cutting down fewer trees gets us a lot of the way there. Then we've got our technological carbon removal. Let's say we build a bunch of machines to suck carbon out of the air too. That gets us more of the way there. If we go back to our temperature change, we've gotten closer to our little target lines here. We've gotten closer to below 2 degrees, but we're not quite there yet. What else could we try? We've got a lot of buttons on here we haven't moved yet. Yes, there's a lot of organizations working on this, and we're very grateful for them. Actually just got back from Olympic National Forest and our Olympic National Park, got to see some wonderful old growth. Really special. Wind and solar power, yeah. So we've made fossil fuels more expensive. Let's try making renewables cheaper. Ooh, look at that. So when we subsidize renewables, we're actually getting better health outcomes and lower cost of energy. So we're getting easier access and better health. That's really key here. Great. Electric cars, electrify everything. More great solutions, right? So right now, industry, buildings we use a lot of gas. They use some oil. They use a lot of electricity. Our electricity maybe is coming less and less from coal and oil because of what we've done over here, but buildings might still use a lot of gas to heat, right? We've still got a lot of gas stoves around the world. Let's try to electrify everything. So we can electrify our cars, subsidize those. We can electrify our buildings. Ooh, that's nice. It makes a really big difference. Again, better health. We're using more electricity, which is already mostly renewables. Let's look at our energy chart again. Look at all those renewables. We are using a lot of wind and solar power later in this century, and we're getting better health outcomes. We're using more of that renewable electricity, and look, energy is now cheaper at the end of this century than it would be under our normal we don't do anything scenario. So we're actually improving access through subsidizing renewables and electrifying our systems. We're actually improving access now instead of making it worse. So this is really big. Oh, and Cynthia comments, building electric cars uses too much carbon. I do carbon accounting, carbon footprinting. I've worked on transportation and different cars and fuels. Batteries for electric cars take a lot of energy to make, but way less than burning oil. So electric cars are still better, even though they cost a lot to make. It's a trade-off, but it's worth it. Yes, I'm glad people are asking questions. That really helps. Yeah, and better public transport. So efficient, we can improve efficiency. That's maybe making some more buses so everyone's not driving around in an electric car. Electric cars are great, but they're still cars, and they still make traffic worse. So if we improve efficiency for our buildings, whoa. So we're using a lot less energy, and energy is cheaper. That's pretty cool. And hey, look, we're at 1.9. We're below 2 degrees. We've met the base goal for the UN climate goals, UN Paris Agreement. Can we get even lower? What's one thing that you'd like to see that more of, or that we haven't touched yet? What's something you've heard about you'd like to just see what it does? Stopping air traffic. There isn't a button on here for airplanes, unfortunately. So that's a little harder to look into. Nuclear energy, yeah. Let's see what happens. We have a, yes, it's a hot topic. Which is one of the things, so yeah, in this model, you can kind of see, if we look at oil just as an example, yes, literally, we could actually subsidize oil more if we wanted to, but not very much. We kind of assume, the people who are making this kind of assume you probably want to tax oil. Nuclear is right in the middle. We could tax it or we could subsidize it. We want less of it or we want more of it. We could tax it a whole bunch. I don't really see much of a change there. We could subsidize it a whole bunch. And we use quite a bit more. If we did a lot more nuclear power, we'd use more of it, right? Over the next 100 years, over the next 80 years. But it's not taking much away from fossil fuels. It's kind of taking away from renewables. A little bit from fossil fuels. So we can make energy cheaper, but it's not changing a whole lot in terms of our, and creating toxic waste. Although I have to say, I read there are different kinds of nuclear reactors that we could build that would basically use waste fuel from the reactors we have now and turn it and use that for energy, and it would end up being much, much, much less toxic, much less radioactive. So thank you, June. Yeah, I know we're about at the end. So there is nuclear power that might be better than what we have now, but of course, we'd still be an issue. So yeah, access to family planning resources. Maybe there, so we're all, again, everything in this model is what's feasible. So maybe we underestimate the effectiveness of the family planning resources we want to put around the world. So maybe population grows a little slower than what we see today. Well, we've already done so much. If that was the first thing we'd done, if that was our first tool, we would have seen a bigger difference. But yeah, here's some tools. So yeah, again, we did it. We met our Paris climate target. We improved access to energy. And I'm just going to look at health one more time so we can kind of end on that. And we improved really our air quality by a really stunning amount. So there's lots we can explore with this tool. If you like this, please contact me. I'll put my contact in the chat. And I look forward to connecting with you more after the meeting.
Thank you so much. That was incredibly informative. And I think that all of us could play with the toggle it all a little bit differently and see what the outcomes are. So that was a really fascinating tool to see. So thank you for the demo.
I learn new stuff every time we do it.
Yeah, and the questions. Wow, you really got the discussions going. So clearly it's a good hot topic. Just a little FYI, during the next break, Dr. Kathleen will give a short demo on how to get into Canvas so we can continue these conversations, etc. And I'll give another shout out before the next break. But next up, we have mental health and family systems with Dr. Stephen Wilson. So Dr. Stephen Wilson is a highly regarded teacher at the University of Washington, has an enormous amount of in-practice and scholarly knowledge regarding cross-cultural treatment interventions and African-American mental health, focused on children, adolescents, and families. Welcome to the stage, the Zoom stage.
Thank you. So I'm just going to start here. I have a story for you. Actually, there's two. So my parents live in Vacaville, California, and on August 18th, 2020, I heard that there was a fire down the street about 3 miles from where they were. And I called them and I asked, how are you doing? And they said, we think we're okay. It's not real close yet. And I'm thinking 2 or 3 miles feels a little bit close to me, but they said, we'll be okay. About 3 hours later, I get a phone call from my mom saying someone's coming to get us. And we're gonna go stay at someone else's house. We're all packed up and we'll let you know how we are. About a month later, my brother, who lives in Bonnie Lake, was asleep, and I was listening to the morning news on the radio, and I heard that there was a fire coming up the hill towards Bonnie Lake. My brother lives about 4 miles away from where this fire was. So I texted him and I said, hey, are you guys okay? Have you heard about the fire? And I didn't hear from him. So then I called and I said, are you guys okay? And I called again and I called again. And I thought, oh my goodness, the electricity must be out. His phone lines must be down. So I texted one more time and then he called me back. And he said, nope, actually we're okay. We're thinking about where we're gonna go. But so far we can get out. And I said, I heard that 410 is closed, which was the main way to get off of the hill. But he said, we have another route out. So that's the beginning of the story. And when I think about climate change, what I know is that a lot of climate change has affected what's happened in our region. We've had more fires. There's been a lot more fire emergencies. There's a lot of dry land around here. And as a result of that, over the last several years, we've seen an increasing number of fires. So I wanted to set that as the stage to begin to talk about family and family systems and mental health. So let me introduce you to my family. This is the Wilson side. The Wilsons are the African-American side. What you see are myself, my 2 older brothers, their partners, and their daughters. This is the Mac side of my family. This is my wife. From right to left, it's my wife, her oldest daughter, our nephew and his daughter, my oldest daughter's husband, then myself. I'm sorry, you cannot see the slides at all?
No.
We can't see your screen.
Well, that would be helpful, wouldn't it? 1 second. I know what to do. My apologies. Bet you can now.
Beautiful, thank you.
Good deal. My apologies. See, I am at, let's see, from current slide, we'll go there. There we go, here we go. My family, all right, so this is the Wilson side. Better? Yeah, much better. All right, so this is the Wilson side. These are myself, my brothers, this is my sister-in-law, this is one of my nieces. This is our daughter. This is my other brother, that's his daughter. This is my sister-in-law, this is my wife. That's our other niece, who's daughter to this man and this woman. This is the Max side of the family. So from right to left. So move some things over for a second. From right to left, this is my wife. This is our oldest daughter. This is our nephew-in-law and their daughter and his daughter. This person is Jack. He's related to Holly. This is our youngest daughter. Okay, this is me. This is my sister-in-law. This is our son. This is his wife. This is my brother-in-law, and this is my niece. This is the entirety of the family at my graduation a couple years ago. So that's them. Now, here's something you should note about these two people. This is my dad and my mom. My dad is 89. My mother just turned 89 on Mother's Day. Our father has dementia. My mother has rheumatoid arthritis. They both still live in their house, which was actually a decision that they were about to change before COVID so that they could move into limited living housing, but COVID made the choice for them, so they ended up staying in their home, which thank goodness they did, because had they not been in the home, they might not have been able to get out with the fire. Here's the next issue. So what is a family? When I think about families, families have shifted over time in terms of how people look at them. Traditional families of African descent have included people who are an extension in terms of family, people who are non-related. So I have play cousins, I have real cousins by birth. But when I think about families, I think about parents and children, adults and their children, adults living together, a lot of times extended family. A lot of times people consider themselves family whether related or unrelated. And then there's chosen members of families. So as I think about all of those family identities, I also want to bring in the notion that how mental health affects people. So here's the next thing. Remember I was speaking about the two fires? Well, here's what we have learned about how fires affect people. Right after that, we're talking about acute stress. And then within months of that, we're talking about PTSD symptoms. People end up with nightmares. They can see the fire, they can hear the fire, they think about where they were, what was happening to them, whether or not they were able to get out. They have a heightened sense of awareness. As I indicated, their sleep shifts and sometimes is incredibly disrupted. The communication waxes and wanes. Quite often, there are some people who are able to speak about their concerns a lot, and other people get really quiet. So communication is a variable. What we often find after post-fire is that people's mood shifts, and as a result of their mood shifting, sometimes they're labile in terms of whether or not they're able to handle emotional situations that normally they would be able to handle. Sometimes they find themselves in situations where they're so upset that they just can't control how they feel. Other times they might be underwhelmed. And the other thing that happens is that people find their social interactions become limited, mostly because they're working on their own healing. And or if they're not working on their own healing, they're also in a space where where they're incredibly isolated, and so the social relationships diminish. I was speaking about fires and how they've affected people, but I want to connect it directly to climate change. So I love this piece of research. I love these several pieces of research, but climate change induced disasters have a high potential for immediate and severe psychological trauma, from personal injury, death of a loved one, damage, pets, disruption, loss of livelihood. A number of studies, and what's interesting about this variable here is that between 7 to 40% of people who experienced a climate change related disaster, and in this case, I'm looking at fire, between 7 and 40% of the people who experience these showed some form of psychopathology. We're looking at this from the standpoint of being extremely anxious, generalized anxiety, phobias, somatic complaints, pains in different places. What we know is that when I think about trauma, I think about a movie that's in my head, and I think about how my body feels when the trauma occurs. And so then that body sensation tends to travel with me. Every time I experience a thought about the trauma, I may feel it on a spot in my body. Many people turn to alcohol. We've seen a lot of depression and substance use. And what's fascinating to me is that alcohol use was higher in terms of frequency than substance use. My experience is that they're both interrelated. Remember, I'd spoken about this notion of paying attention to acute stress, PTSD, and compounded stress. And I think one of the things to really attend to here is how does the trauma that occurs during a disaster, and how does the trauma that occurs if we experience a trauma again and again and again affect us over time? In communities, what we see are aggression, mental health emergencies, suicidal ideation. What I worry about, particularly when people get displaced, when I'm thinking about fire, a loss of place, a loss of autonomy and control. Quite often people feel helpless. I decided to put Inside Out in because what I loved about this movie was the importance of being able to express a range of feelings as healthy as one can. And what I hope over time, and what we hoped over time, particularly during this emergency with my parents and with my brother, was to give them some choices. So this brings us to this notion of people who could respond in terms of a family system. So there are 4 different sets of individuals or sets of people that were able to respond to my parents. Us, who lived here, and what's interesting is the three brothers live here in the Pacific Northwest. My parents have a huge church family. Their neighbors next door got extremely worried about them and were wondering whether or not they could offer them some support. And their caretaker was not able to get to them. What was interesting is that their church family were the people who said, "We're coming to get you." In the case of, thank you, Jacqueline. In the case of my brother's families, my niece, community school business associates, and the daughter in England, as you can guess, the people who are able to give them the most choice were the folks who were the closest to them. It's community school and their brothers. What we were hoping to do was to reach out to them. And the thing that we focused on a lot was, we know that you know what is going to work best for you. And so what we wanted people to have was as many choices as they could. So when we gave information to both my brother and to my parents, we asked them, where's it you want to do? Where's it you want to go? And what do you want to do? And my mother was able to say, here's where we want to be, and this is where we're going. And my brother ended up choosing a choice that none of us had offered him at all, which was, we're going to decide to go and live in a hotel rather than come to anyone's house because we want to get to work. So a big piece that we focus on was the importance of self-care. I'm going to move on for a second, because I want to let you know what they ultimately decided. When my mother and dad went to when they went to this person's house, they had to go up a flight of stairs. My father has dementia. He was absolutely disoriented. He didn't know where to go, and he couldn't figure out how to move around in the room. My mother with rheumatoid arthritis could not get up and down the stairs. So ultimately they decided to go back home after one night, and they just dealt. And thank goodness the fire department was able to put the fire out so it didn't get close to them. On the other hand, as I had indicated, my brother decided that they wanted to go to work. And so they stayed in a hotel. And while they were in a hotel, my nephew, the person I spoke of, my nephew with the little girl on top of his shoulders, he was working on the team to put the fire out. So there were a lot of people working on behalf of my brothers to support them in terms of what they did. But ultimately what happened is that they ended up going home after 2 days also because the fire was out. The big issue for me here was that in each case, all of these people's mental health depended on people offering them support and then giving them choice. And as those people gained choices, as they executed their own choices, so they were able to do things that took better care of their mental health. I realize I'm over time. Thank you very much for listening, and hope this was helpful.
Thank you so much for sharing your story. And I think the overall theme is support and choices, community, family, and self-care. Powerful reminder that we all need, especially in this global time we're in right now. So thank you for your story and for teaching us about those topics. Next up, we have climate, mental health, and emotional resilience. So Leslie Davenport, climate psychology educator and consultant, is a leader in the emerging field of mental health and climate change. In her own words, psychological perspectives need to be at the table of interdisciplinary conversations generating effective climate solutions. Psychology is powerful in addressing the emotional underpinnings of climate denial, understanding motivators for change, identifying the most effective communication strategies, as well as building resiliency when individuals and communities are faced with immediate and long-term climate chaos that provoke trauma, grief, anxiety, and depression. Leslie's talk presents both information and practical tools. Welcome.
Thanks so much. Thanks for inviting me into this really rich conversation. And I'm calling in from Tacoma, Washington. So I also want to do a land acknowledgement of the Puyallup tribe. So let me get my screen share up and going. And let's see. Okay. So what I want to share with you briefly today is kind of a look under the hood of how we're put together, the ways that our thought patterns, our emotional landscapes are so powerful, more than we realize, and that in a way they're sort of invisible drivers in climate change. So that it's not just what do we need to do to cope with the aftermath of environmental disasters, but how does our fundamental way of perceiving ourselves within the natural world play a part in the problems that we're all facing here together? So, we like to think of ourselves as very rational people, and we make rational decisions, and that's certainly a part of things. I hope that part of my brain keeps working for a long time, and it's why we're all here at the same time and have technology. But it's such a small part of really what's available to us as human beings. And Losing touch with our intuitive knowledge, losing touch with our somatic-based, body-based knowing, losing touch with our creative ways of knowing, our ancestral ways of knowing, has really cut off parts of ourselves in a way that is parallel to the ways we've cut ourselves off in our society and how we're acting, as if we were independent rather than interdependent, operating in these unrealistic silos that we don't even realize are foundational to our belief system. So there is this emerging specialization within psychology that's being called climate psychology, and these are some of the areas that are being explored. So what is it underneath denial that when we are faced with facts and science, there's actually an emotional part at play here? What are the most effective motivations for change? Change is challenging. It's not just a matter of presenting the facts again. What else is going on? I mean, we know this in health, right? Health psychology. It's not enough to stop smoking by reading off the statistics of why that's a good idea. And the same is true on this larger scale. As was being addressed in this last talk by Steve, there is a lot of trauma, loss, grief, and anxiety that's happening now, and even more likely to unfold. And how do we build emotional resiliency in a way to be present with that, to move through that? The way that being engaged and part of something meaningful part of this change can help with the feeling of hopelessness and helplessness, which are characteristics of depression. But honestly, the whole mental health field needs to be educated and elevated in this way. There are no requirements at this point about competencies in climate awareness. So if an anxious eco-anxiety is showing up in a therapy room, if a therapist doesn't have an awareness of climate and what the realities are, the blame can be directed back at the client for exaggerating rather than validating why this would be arising and working with it. And then taking these tools, like how do we work? How do our brains work? And making that available so that when all of our work is happening through agencies or nonprofits or in whatever kind of a setting, we can communicate in a way that encourages engagement and doesn't push people away. And then how to make these resources very widely available and to be collaborative in our approaches. So as was mentioned already, global warming in the coming years, and it's already happening, but again, the sense in very parallel graph, kind of escalating along with what we saw in rising temperatures and health effects. In the coming years will foster public trauma, depression, violence, alienation, substance abuse, suicide, psychotic episodes, post-traumatic stress disorders, and many other conditions. So what exactly is resiliency, emotional resiliency? And if you were to Google it, the conventional definition is the ability to bounce back from a stressful experience. So whatever your baseline was, you're going to be able to kind of return to your normal. But that doesn't work very well with such a changing landscape that we're all on, because there is no going back to. In fact, things are changing, and it sounds like even if we get a good handle on this, because of how long some of these things happen in climate time, the increase in intensity and suffering and challenges are going to also be on the rise. So I've been redefining emotional resiliency as cultivating the ability to remain present, open-minded, and empathetic in the face of increasing stress, so that we have an ability to bear witness to and be present with more. So how do we do that? How do we do that? A really helpful model, and this comes from trauma studies, is something called the window of tolerance. It's also called the zone of resilience. And the idea is that we all operate within this sort of window, and it shrinks and it expands. And if we're within our window of tolerance, we can handle challenges, we can deal with what's on our plate. But when it gets too big, there's too much, it's too intense, or our window has shrunk because poor nutrition, things we've talked about, lack of sleep. There are very concrete things that can stretch and expand this window. We tend to either lash out or check out. And this is a self-survival mechanism. It's just too much. And so we turn off in some way, and we either fight to push things away from us, or we just stonewall and we can't hear another thing. So part of building our resilience is learning those things that can stretch that window, being aware of those things that shrink that window, and becoming more aware of where our own personal edges are. And you know, there's so much in there, like I said, nutrition, sleep, like the most fundamental parts of, you know, good mental health hygiene, but also things like trauma, you know, that it start to fill up that window. And so learning to getting support for metabolizing and working through difficult emotions, clearing trauma, expands our window of tolerance as well. Another idea when it comes to climate change and communication is toggling, which means we need to be truth tellers, but we need to be empathetic, compassionate truth tellers. So as climate change information is communicated, we also have to pair the tools alongside it. And that ability to go back and forth with challenging information and ways to work with it and ways to work with our own reaction is the notion of toggling. Because that's one of the reasons why if we give people a lot of information and it's overwhelming and they don't know what to do with it, they tend to disengage. There's this thing called apocalypse fatigue, and it just pushes people out of their ability to be present. We also don't realize that we are viewing the world and perceiving the world through lenses that are called cognitive biases. And all of this comes out of our own evolutionary trajectory of how our nervous system, again, gets programmed. And these are a few of many, 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 but it's things like we tend to seek out the information that already confirms what we believe, and we kind of turn a blind eye and minimize facts that oppose that. And we don't always realize we're doing this because human beings are generally loss averse and risk averse. We tend to put a little bit more of a rosy color on things much of the time as a way to not feel the distress or the threat. So it gets minimized in a way that's not helpful in addressing the realities. We also, both by circumstance and by neurological programming, tend to deal with what's right in front of us. Most of us are dealing with families, getting food on the table, paying our rent or our mortgage, and that's filling up our plate. And the ability to stretch out into the past and the future gets pushed off. That'll happen somewhere else, some other time, other people will take care of it. And I want to underscore these because Both it brings some compassion to how challenging this is and what's at work in us in attempting to face this. But like so many things, once we bring it to light, increase our awareness, we can begin to work with it and dismantle those lenses for more realistic ones. So this just goes back to the idea that not only do we need to cope better in the way I'm talking about resiliency, but I also really believe we need to bring these other parts online that have become dormant, like the importance of an intuitive and creative approach to this, to think in different ways, to not approach things in the same ways we have before, hold so much power. So I feel like that's all what we're still learning to do. I would, can I have a time check here? Because I want to do a very short experience. How much time do I have?
About 2 minutes.
Perfect. Okay, 1 minute here. I'm going to ask you to join me. Either close your eyes or just let them have a soft focus. And bring your attention to your breath. And as you breathe in, just breathe in the fullness of this life, the richness of what you've heard. And when you breathe out, just let it sort of settle within you. Feel your feet against the floor. Sense or imagine the floor against the foundation of the building, being supported by the earth. And sense the space above you, the sky, the biosphere, deep space. And just take a moment to feel yourself held, part of, connected to this much larger web of life. And then as you prepare to open your eyes, see if you can blend that awareness, even while you have more sensory input with your eyes open back in front of the computer screen, but beginning to blend that awareness. So this was so short, I just want you to be aware of a couple of resources. The one on the left was written for the mental health field, but it's very accessible and easy to read, has lots of practices. And I have a book coming out that's very similar that pairs resiliency and climate science. That's for 8 through 12-year-olds. And I think questions and comments will have to wait until our panel. So thank you all.
I loved that exercise. I feel real connected to the biosphere and deep space. So thank you for that. I was like, woo. That was amazing. So we're going to take a short break now, and Dr. Kathleen will be doing a short demo on how to get into Canvas for those that are still searching that. So please come back 12:10, 12:15, and we'll get started with the panel.
Hey, everybody. I hope those of you who are still struggling with Canvas are here. I struggled with it myself and had to call our IT expert. So I feel you. So the main thing where people get hung up is after enrolling, they may have missed the confirmation email that the program uses. So Canvas will have sent a confirmation email to you, and you have to find that and click on it. But I'll just take you through the steps using an alternate account of mine, so you can see, so we can all do it together. So in the chat, there is the Canvas enrollment link, and then the conference Canvas page link. So let's start with the enrollment link. I'm cutting and pasting this here, or just clicking through right here. That's not working, so I'm going to cut and paste.
You want to share your screen?
I do. I just need to get this up first. Okay. Oh, it says host disabled participant screen sharing. So I thought I was a co-host.
You should be able to try again.
Okay, there we go. Okay, so we see you are enrolling in health in the climate crisis, blah, blah, blah. Enroll. Yes, I do want to enroll. Ah, it says that I've successfully enrolled because I already enrolled. Let's see. I don't think I can do it in from a different email address because I already did it. Why don't we, I'll just show you the next link and then let's do some troubleshooting.
Kathleen?
Yeah.
This is Shauna Gallagher.
Shauna.
Like I'm confused. We're already on the Zoom meeting, right? Or we need to do something additional?
So we're on the Zoom meeting. So this Canvas link is for course materials. So this is where you find speaker bios and links and part of the amazing organizations and work that these people are part of, and where people in the conference can interact with each other on discussion boards and make some really valuable connections. Also, there's a post-conference survey there, and from those responses, two people will be chosen, one for each day of the conference, to get a gift certificate to 8th Generation. So this is really for all the wealth of supplemental materials. And hello, Dr. Gallagher. Nice to hear you.
Thank you.
Does anybody else have any immediate questions before we look at the other one?
Can you just tell us if there's a downloadable version of the transcripts?
There is not a downloadable version of the transcripts yet, but we are recording this. And I believe there'll be a transcript with that in about a week.
Okay.
So that will be sent to you via the email that you used to register for the conference.
Perfect. Thank you.
Sure. And I'm not sharing, so I can grab this other email. And put that up. I mean, other link, not email. All right, so I just cut and pasted the second link into my Chrome screen. So I'm going to share again, so you can see what that looks like. So here I am in the conference Canvas page. So there's the registration link, there's the Zoom link there, and the very all-important post-conference survey. And then all the speakers and the agenda. So say we wanted to hear more from Claudio Rodriguez. So you could click on him and then see so much more about him. So his, how to reach him on Instagram, the registration for his summer program, etc. So I want to go back to, let's go back to here. Let's say I want to know more about the wonderful speaker we just heard, Leslie Davenport. So I click on her. And here we got a link to her website, which is full of information, and all 4 of her books. So also let's look at discussions. So discussions are set up for each of the main sections. So if you have questions, if you want to say, hey, I'm doing this thing. Does anybody else in this forum, would anybody else like to participate? This would be a great place to do that. You can also email me or Lev, the conference, some of the main conference organizers, among many. All right, does anyone have other questions about Canvas? Okay, I'm around, something pops up. If not, have a great break. Bye.
All right, everyone, welcome back. Next up, we'll have a panel discussion on mental health. It'll be facilitated by Rachel Heaton and include Dr. Shauna Gallagher, Attorney Hallie Love, Dr. Steve Wilson, and Leslie Davenport. So Rachel Heaton describes herself first as a mother to 3 beautiful children. As part of the coalition to lead Seattle to divest from Wells Fargo, one of the main funders of the Dakota Access Pipeline, she became co-founder of the Indigenous-led divestment organization, Mazaka Talks. She is a cultural educator for the Muckleshoot tribe, working to learn, build, and sustain indigenous cultural practices. She has extensive knowledge of plant medicine and how connection with nature heals the body and spirit. Rachel is facilitating this panel on mental health to bring forth multiple paths towards resilience, especially in the face of trauma. Dr. Shauna Gallagher serves as a key member of the Seattle Indian Health Board's multidisciplinary leadership team. SIHB is establishing an Indigenous trauma-informed care model to ensure holistic care, which is traditional healing and medicines, medical, dental, mental health, substance use, and case management, are being offered and provided to meet the needs of the population being served. In Dr. Gallagher's direct clinical practice, she specializes in trauma-informed care and addictions and has been successful in weaving Indigenous psychology, beliefs, practices, and ceremonies into Western evidence-based practices. Then we have attorney Hallie Love is a yoga therapist, a meditation teacher, and a positive psychology instructor. For over 20 years, she has been teaching individuals and groups effective and evidence-based ways to build personal resilience. Hallie authored a book about well-being published by the American Bar Association, has been a featured speaker on mental health topics at several US conferences, and currently has a private yoga therapy practice in Santa Fe, New Mexico. Having completed climate reality training with former US Vice President Al Gore, and having recently completed the Yale School of Public Health program in climate and health, Hallie is committed to helping people adapt mentally, emotionally, psychologically, and spiritually to the challenges of living in the climate crisis. And we also welcome back Dr. Steve Wilson and Leslie Davenport, previous speakers from today, as being featured speakers on the panel. So let's get started.
Sorry, I was having a problem unmuting there. Good afternoon, everybody. I am honored to be here with each of you. First, I want to thank Bastyr University, particularly Kathleen Lumiere, for inviting me and allowing me to be a part of this conversation. Again, we have a great panel today. I'm honored to be on here with Dr. Shauna Gallagher, Hallie Love, Dr. Steve Wilson, and Leslie Davenport. So thank you all. I believe that I was chosen as a facilitator because of the perspective that I bring. First, I'll again just kind of lightly introduce myself, and I will ask the same of you from your perspective and how it fits with this conversation today. I go by she, her pronouns. My name is Rachel Heaton. I am a member of the Muckleshoot tribe, and I'm also a descendant of the Duwamish people. So my ancestors are directly linked to the shores there of Lake Union, and we have villages that were placed all the way down to Renton. I am a member of Mom's Clean Air Force. We fight pollution for our children's health. I'm also the co-founder of Mazaka Talks, an Indigenous-led organization that focuses on the divestment from large banks that contribute to the desecration of Mother Earth through fossil fuels, but also the violation of Indigenous rights. And so I organize with 350 Seattle, and I'm also appointed to the oversight board for the city of Seattle for the Green New Deal. And then I'm also a cultural educator for my tribe. Western ways would like to call me a climate activist, but I like to think of myself as a protector of Mother Earth. Ultimately, the work that we're doing is protecting Mother Earth, and these are the various ways that we have to go about it. But more than ever, our conversations are intersectional in so many ways. And this is an opportunity for us to talk about how each of these areas cross and connect. And so in this case today, we're talking about health and mental illness and the climate crisis, and in what ways are those related. And so to me, I believe we have to talk about what is the crisis, what are the commonalities, and how do we come together to come up with integrative ways to heal. And so I believe it takes every one of us from different fields and life forms to address the issue of climate crisis. We have to recognize the relationship we have with Mother Earth, with the plants, with the animals. We have to understand that all of these are parts in the healing of ourselves and also Mother Earth. And so I believe that's how we can cross and to have the conversation of how is climate crisis related to health. And of course, we can touch on tons of different areas when we go into statistics and suicide and all of those various issues that do connect. So today, I'm really excited for the panel that we have. And so because I trust that everyone that's on here, they are the experts in their field. And so I'm learning from you as well as you're learning from me. And so today I just have a series of questions that I've kind of posed to everyone. They're very light questions, but I want to hear from your perspective because I feel that I'm on here as a Native woman and can only share that perspective as a Native woman and another Native person can. And being involved in the work that I'm in, I believe the concept of mental illness and beliefs and behind how it develops and the various meanings, it touches on all of us in different ways. So as a Native person, you know, for us, we look back at colonization, residential schools, the removal of culture, language, personal values, the introduction of alcohol into our communities, systemic racism that has played out since the beginning of colonization, and then also, you know, our BIPOC communities can also relate in various ways. But again, this is how we have those conversations to discuss those commonalities. So these issues are very much still at play. They plague our communities. And also too, as Native people, being the first peoples of this land, we understand that connection to Mother Earth. We understand that we have to have a relationship with Mother Earth in order to understand how do we heal from Mother Earth. And so again, it goes back to that relationship with plants and how do we use it in our foods? How do we understand that that is about the erasure of culture when we lose these plants for a number of us, the pollution in water and not being able to practice in our cultural practice. If we have water pollution, we can't put our canoes in the water. We can't eat our fish. We can't live off of the land. And so we are directly impacted on that. And as a result of that, mental illness and various issues plague us and all of our communities from that angle. It is proven that Native Americans usually who do meet the criteria of anxiety, depression, schizophrenia, the various line of issues, we typically do seek medicine from spiritual healing. And that is not a common conversation within Western medicine. And so again, these are conversations that we have to start having. And so today, I'm just going to read out loud the questions that I've posed to the panelists that are on here. And I want to give everyone they'll have about 6 minutes to kind of answer the ones that they choose to, how it's related, but also how do we start working? And I guess kind of in that process, how do we start having these conversations together? How do we start working and realizing as Native people, we make up 1% of the United States population. We make up less than 4% of the world's population. To me, that says we can't do this work alone. So how do we all come together and start sharing this knowledge and the ways and expertise that we have, but also while creating equality and fairness across the board on how we work with each other, being considerate of culture, ethnicity, past trauma, generational trauma, all of those things. And how do we approach those ways to talk about the climate crisis and this issues and how they're intersectional? So the 6 questions that I've posed, and I hope everyone, I'm looking forward to hearing from everyone, but I hope everyone that's on here is, you know, is having a great conference and learning as much as they are really, you know, seeking out. So some of the questions that have been posed is, what is resilience and why is it important for individuals to develop resilience regarding climate change? What are some ways to build resilience? What are your goals moving towards regarding your work in climate education and resilience training? What do you feel are some helpful ways we can help others understand the climate crisis and mental illness relation? Do you feel generational trauma is factored in restorative healing of the climate crisis? And the last question is, how can we be better stewards of this work? And so with that, I'm gonna go ahead and let's hear from our panelists. So first up, I'm gonna ask on Dr. Steve Wilson, and then we'll go from there and we'll hear from him, and then we'll move on to our next guest.
Appreciate you. My name is Dr. Steve Wilson. I am a person of African descent. I am also a person of Choctaw ancestry. My great-grandfather came back from the Trail of Tears back through Mississippi and bought back our land. But the life that I live as a person of African descent. I'm thinking about these questions, and I actually love the questions. Resiliency, and why is it important for individuals to develop resilience? I think a piece of what has always been true about persons of color living on this continent, that is including the Native American ancestors, as well as my African ancestors, is that we've always had to bend and adapt. And one of the pieces that I talk with my daughter and I speak with my students about consistently is having to make adjustments, that we've always been doing that. But the problem becomes the more adjustments we make, the less resources we have. As a result of having less resources, we're continually having to make do. In making do, what we've set up is a system where nothing ends up coming our way. When I speak with young people about resilience, and when I speak with young people about the environment, I'm always thinking about how do we work on being good stewards? How do we take care of the space that we live in? How do we take care of the water? How do we maintain our yards even? And I just think about my yard. My yard is full of moss. My yard does not have chemicals on it on purpose, because what I've learned about chemicals, besides the fact that they kill all the ground cover, they also kill all the animals in the region or in the area. We've had bees in our yard for the last 15 years. I worried 2 years ago when bees didn't show up, and then bees came later. And every year I look for the bees to show up. And I've taught my daughter to look for bees. I've taught my nieces to look for bees, because what we know is that bees actually support the ecosystem. Less bees equals less food. And ultimately, if there's less food, then we got to figure out what else to do. Now, one of my nieces has since made a decision to become a vegetarian. My daughter has made a decision to move towards vegetarianism. they're working on me on that. I'm still not there yet. But what I love about the way that my daughters are approaching this is that they paid attention to what they learned from us, and they've also studied themselves, because we value this notion of them becoming more educated about the world that they live in. And because they have, now they've made some decisions that are saying, Dad, why are you eating the way that you eat? You're gonna have to stop doing that. And the more they work on me, the more I listen. So I've increased my vegetable intake. I've increased I've diminished the meat that I eat. Hopefully what that does is give me a longer life. Hopefully what that does is allow them to see that the more that they can do in the world to support elders to stay around longer, the more their efforts can be rewarded. The other thing I think about in terms of resilience is that our daughters are all gardeners. Last year, my daughter built for us a garden, and we had more vegetables than I've seen in years. My daughter is taking a tradition that was passed on by her great-grandparents, and she continues to do it even though she lives in Seattle Metro and she lives in an apartment, but she's growing her own food now. So when I think about resilience, I think that a piece of resilience really is about the practices that I carry for myself and what I do. And then how do I pass that on to other people in my family? I hope that answers some of the question. That's just what was off the top of my head.
Thank you, Dr. Steve. I appreciate that, and I love hearing about the understanding that relationship with the bees. You know, we have to recognize when we don't have bees, we don't have food. But also part of that too, I believe part of that resiliency that you speak of, it really is what are we doing now to teach our children, and what are they pulling from our elders, you know, at the same time? Because I know as Native people, elder wisdom is one of the things that has carried us, you know, through these times, to carry these teachings and that connection. So I appreciate your perspective, and I'm happy to hear that you're making little gardeners, because I believe that's a form of resiliency, when you can grow your own foods, when you can take care of your families in those ways. So I appreciate, you know, you sharing that perspective. So so next I'm gonna go ahead and move on to Hallie Love, and she's going to share a little bit of about herself and her question. And so we'll go ahead and move to her. So welcome, Hallie.
Thank you so much. I'm very excited to be part of the conference, and it's been a wonderful conference. Tremendous learning opportunity for so many people. I'd like to address the question of what is resilience, and I'm addressing it from my field of mind, body, health, and well-being. I've been teaching mind, body, health, and well-being now for over 20 years. Prior to that, I was an attorney, and from being an attorney, I really needed, when I decided to not be an attorney anymore, how to gain well-being and resilience. So I became and trained in the mind-body healing arts, and then went on to meditation, instructing, and went on further to positive psychology educator. Then I came full circle and started teaching well-being to attorneys in large conferences and international events. I went on to being a resilience trainer in many capacities, not just attorneys. And then I decided to really hone my skills and experiences to help regarding the climate crisis. As a climate reality leader in Al Gore's training, and then on to what I learned at Yale School of Public Health, I'm committed to educating people about climate reality, but in a way that does no harm, in a way that really gives them the skills to address, perhaps if they feel anxious, address those anxieties in a way where they feel safe to be able to understand climate reality, and then begin talking and teaching others. Communication of climate change is imperative in moving forward to solutions. So resilience, many people might think of resilience as being Well, somebody who's resilient is very able to persevere and be determined and has grit and has optimism. It's true that those are qualities a resilient person can develop. But the big question is how to get resilience in the first place. And even a bigger question is, what is resilience? I really enjoy and teach from the definition that has an understanding of how to obtain resilience. So the definition that I like to teach from is that resilience is a process to develop and harness internal resources and strengths to sustain well-being. Well, those same internal resources one can learn and develop also prevent and heal anxiety, help with depression, and help with chronic stress. On all of those things, help people to do appropriate self-care, such as sleep deeply. You can't tell an anxious person who's already anxious because of pandemic anxiety and pandemic anxiety reentry and all of the loss and grief and all of the problems that we've gone through, and then heaped on top of it, education about climate reality, climate change, and the folks that see the disasters or have the disasters happening right in their face. You can't just tell those folks to be okay, sleep well, take care of yourself. They need to have internal resources to be able to do that. And that's where I come in with wanting to teach the skills of resilience that help people to have anxiety resistance, to develop a nervous system that has the capacity to be okay and be safe, to have people understand that there are skills to learn how to go into very deep relaxation. And once in deep relaxation, their nervous system starts to reset and rebalance, and they can obtain a way to feel okay again. And when they obtain that and they're sleeping well and the self-care is happening, they can also start to develop what positive psychology has to offer, that ability to feel more positive emotions. Not only feel them, but do exercises to help boost their own emotional resilience by healing themselves with more resilience from positive emotions, which turns off stress. And there's also ways to develop optimism. Optimism and hope are really important to be able to be resilient, to adapt and cope with climate change, and also be okay enough to learn more about climate change and to be able to start talking about it. And we heard yesterday how important talking about climate change is to educate other people. We are our best influencers of our friends and our communities. We can start to help people learn how to advocate better, not only just politically, but as consumers. We can, with the understanding of how climate change is real, how it's harming people, how scientists agree that it's real, all of those things, the fact that there are solutions, and there are solutions to climate anxiety as well. So a whole lot of the alarmed population that really knows climate change is real, a lot of those folks are climate anxious. And when you're climate anxious, a lot of people feel a paralysis, an inability to engage in climate understanding, education, talk, or action. So to heal those folks, we might have a whole variety of people that can become climate champions. And that's the field that I'm in, and that's why resilience is so important.
Thank you for that, Hallie. Thank you also too for tying in the realities that I don't, like we've said before, people don't really tie climate crisis and mental, mental illness in the same conversations a lot of time. So I'm thankful that you brought that up. Also recognizing the importance of sleep and those forms of building resilience. And just like you were saying, you can't tell an anxious person to sleep, to sleep well, to relax. And I know something typically that I deal with a lot of Native organizers is, we always make the comment of like wearing the weight of the world on our shoulders. And it's literally, you know, the concept of like, we don't have clean water, we don't have clean air, we don't, you know, some of our tribes don't have running water. So these are all very real issues that impact our community. So I'm glad that we're finally having the conversation of how these pieces tie in, but the importance of resiliency. But I do also know that resiliency, I think, is different for each of us when we look at also, again, generational trauma that plays out through Native communities and the impact that that's created around resilience as well. So thank you for everything that you've contributed to this conference and your words today. And also, I would like to move on to our next speaker. I would like to introduce Dr. Shauna Gallagher, and she is going to tell us a little bit about herself, and then to the questions that, any of the questions that she would like to answer. So welcome, Dr. Shauna. Oh,
Okay, can you hear me? You guys can hear me?
Yes, ma'am.
Okay. So I would like to, first of all, give a little background of where I'm from. I was born and raised in Chiloquin, Oregon, which is Southern California, on the recognized reservation boundaries of the Klamath, Modoc, and Yahuskin Snake Band Indians. And I'm an enrolled member of that tribe and raised by my mother. And then I would also like to acknowledge that I'm half Swedish as well. So growing up and looking at systems and looking at these climate changes my entire life, and being one of the last tribes that was terminated, where they came in and they took all our natural resources, which was ponderosa pine, and then building the dams and those kind of things that had an impact on our hunting and fishing and everything we did as a Native community that still impacts us today. This is not a new crisis for me. It's been going on my entire life, and I've been just watching as the world self-destructs. And so clinically, when I work with our relatives, and we call all our patients at Seattle Indian Health Board relatives, we don't call them patients or clients. We call them relatives. So we're able to really freely use the way we use English language at Seattle Indian Health Board. And so when we're working with our relatives who come in with these years of systematic oppression, generational trauma, lateral oppression, we really work on training our clinicians on how to lift that internalized oppression that happens, because we watch this self-destruction happen for so many years. And we watch our non-native relatives destroying the land. We have to teach skill sets. And I liked one of the terms that Leslie Davenport used, and that was teaching them how to make their world a little smaller until they can learn to manage, but really containing it. Leslie's term was, I had to write that down, was the window of tolerance. So working in the same manner. So we talk about how does our world become small enough so we can learn self-regulation skills and learn the ability to navigate a system in which feels so big and grandiose. And then we have a whole system of government, right, that acts, I mean, clinically insane. And so teaching what is their exposure time to these social media, what is their exposure time to these larger world crises that are going on, and making their world a lot smaller so they can learn to self-regulate within that system. All our treatment plans include traditional Indian medicine. So we really build every treatment plan when we're working with our Native relatives around traditional Indian medicine. So what that means is not just like the herbs and the natural medicines we find on Mother Earth, but it actually means our spiritual practices and our beliefs. So we have the opportunity to be able to bring our traditional practitioners right into our sessions and offer traditional medicines, whether that be song and prayer, cleansing and purification. But really we found it to be so effective because we have to believe right? For each and every population, we're influenced by our belief system. So we have to find belief systems and practices that actually serve the populations we're working with. And so that's where we start. We base everything. Once they come through the door, we use DBT, the 5 senses, which is based on our traditional beliefs and practices, right? Being connected to things that make them feel connected to something larger than themselves is the first sense of a collectivist approach, and being able to feel connected to something larger. Not all our relatives, because of generational and intergenerational trauma, have had the opportunity to have primary caregivers, but we're a collectivist people. And so we're connected on a much larger scale. So from the time our relatives come through our door, we're finding ways to contain them, to make them feel connected to something much larger than themselves. And that through visual, through audio, through, and we cleanse our building every day to purify from any energies we brought into the room or woke up with. And we ground each and every one of our practitioners with, whether they're native or non-native, they can choose to participate. But for our natives, it's really grounding. And for our relatives who come through that door, and we have hundreds come through our door every day. And so they're exposed to these different elements that make them know you're home. You belong to something larger than yourself. Because with our trauma, we navigate this world in such a traumatized way, and we lack optimism because of the trauma. And we work with, so we have a training program too. I'm not trying to jump around, but I've always seen we have people working on the macro level on all of these changes, right? And then we have people working on the micro level, but rarely do we have people working at the meso level, where we're working directly with practitioners in the clinical setting on training them. How do you work effectively with First Nation people, whether they're Native American, non-Native American? We teach them on what does resiliency look like. And for our definition of resiliency, it's never questioning whether you are wanted or loved, right? We have to teach on different levels what that means from a collectivist approach. This doesn't always mean that we had that nurturing childhood and those kind of things that maybe other populations have had, and somehow trauma disrupted that along the way. It means that we start where the relatives are, and then we find their strengths within them. Because I mean, they're walking through our doors and they're 40 or 50 with this trauma. That's resiliency. That's survival. They have made it this far in a world that's very oppressive, and not understanding their gifts and talents or anything they have to offer. So in each one of our treatment plans, when we're working with our relatives, we really identify grounding activities, you know, and a lot of the presenters mentioned these, of what it looks like from an Indigenous approach. How do they ground themselves in the morning? You know, and a lot of that's going out and being mindful and returning to our mindful ways as Native people, and connecting to Mother Earth, and connecting to the wind, the sounds, the birds, the leaves, everything around us. And what does that mean for us as Native people? But really have grounding practices in the morning, have grounding practices in the evening. Anxiety disorders, we feel, are really, with the Indigenous psychology and that approach, are really one of the easiest to treat. So giving them those tools before we work and move into all their trauma, right? Because sometimes the only tools that the relatives have had are defense mechanisms, that's like dissociation and drinking, are things that are harmful. But how do we replace them? And then we move into the traumatic experiences, so they can process through those. And, you know, I always say as a practitioner, nobody's ever walked into my office because of money. I mean, they might think it's that I've lost money, or I'm in this kind of debt, or my credit's bad, or these, they walk in because there's disruption in relationship and they need to belong to something larger than themselves. And so our collectivist approach is very effective, not only with our Native population, but with our non-Native population. And we always say we treat everybody all our relatives from any diverse background, but we treat them in the native way. And so that resiliency to me means, you know, allowing people to understand who they are, to be able to understand where they come from, being able to understand that they belong to something much more powerful than just themselves. And then being able to extract their strengths and gifts and talents so they can thrive. And in regards to these plants, like what are things that they can do to make a difference for their native people, whether it's on the micro level, you know, or as they grow more stabilized into larger levels. And then determining what that looks like on a daily basis. And I believe even on the micro level, when people, you know, like Stephen was talking about, teaching your kids their traditional ways, their traditional hunting. Like all my kids hunt and fish, and we teach them their traditional ways and their traditional practices because those are grounding. And those are what keep them safe in this really unsafe world that we exist in. So I hope I didn't go all over the place, but yeah, it's just kind of containing from a very collectivist, indigenous approach, and allowing people to be able to identify their gifts and talents.
Thank you. Thank you for also sharing that we all need to feel a part of something bigger than ourselves. I think that's what a lot of this work really is. I know we're closing down to the end of the conference. I would ask everybody to please, if you have questions, go ahead and put them in the chat. I know they will get addressed, but if you could just please hear our last panelist. I think it's important that we hear everybody out before we close out. So we're on our last part, and I want to go ahead and introduce Leslie Davenport for being with us, and then we'll get ready to close off as soon as we hear from her. So thank you.
Thanks. I'm just going to add one additional perspective about resiliency, because I did have a chance to speak to it a bit earlier. Which is some of the latest trauma research. Polyvagal theory talks about co-regulation. And what that is that we know instinctively that emotions are contagious. So if you're near someone who's anxious or agitated in some way, we often start to feel that ourselves. Or we're with someone who just, it doesn't matter what you say or do with them, you just always feel better, or you feel more relaxed, or you feel more connected. And the science is starting to connect the dots that our nervous systems start to regulate with each other. So that this idea of pursuing self-care, how can I make myself feel more grounded, and all the variety of ways that have been spoken, is also a communal act. Because of that relates to how we are with other people, not just what we say or what behaviors we do, but in our very presence, in our very shared intersubjective field. Things are happening between our bodies, between the ways we're connected. And so I just wanted to frame that the idea of self-care is also communal care. So that's all I'm going to add.
Thank you so much. Wow, I could have kept this conversation going and listening to each of you even longer. So hey, there's an idea, everybody. But thank you for every single one of you and the time that you spent today and bringing your expertise. I look forward to hearing from all of you again, and then. It looks like we're about to wrap up. If anybody has any questions that they would like to put in the chat, I believe that they're capturing those. And since we have one more minute, if there's any comments that anybody wants to make before we close off, I'm gonna go ahead and turn that over to anybody who wants to do that, and then back to our host.
So far, no questions in the chat. People are welcome to leave some. The specific adaptations to Indigenous informed, not Indigenous informed care, but care that's based in Indigenous practices, how would that respectful, embracing model be expanded to other peoples?
I would say that they're talking to people in Native community. You will have people that will not work with non-natives, and then you will have people that will work with non-natives. And I think as a non-native person, we have to kind of stand back and look at, again, trauma plays into that. So coming from a non-tokenizing role. So looking at your people, people as education. So doing research, looking out for people who are doing the work versus asking people who aren't ready to answer those questions or to be a part of that work. So I think if living in Washington, we have 29 federally recognized tribes. There is someone available in these areas, whether it's even the urban Native community in the city, of people that want to answer these questions and educate. So I believe looking for individuals that are doing this work and just doing the reach out and having those conversations, I think is one way to do that.
Thank you, Rachel. And this is a general question as well. What are 2 concrete or practical self-care things that people can do when they feel overwhelmed by the state of the world?
I can answer a couple. So one, right, is limit your exposure. That's very important when I ask people how do they feed their anxiety or how do they feed their depression. And it's amazing how much people are on social media and feeding their anxieties and depression are totally exacerbated by what they're exposing themselves to on a daily basis. So really being mindful of what they're exposing themselves to in order to regulate. And the second, I mean, breathing, just breathing is so huge. I always say, be mindful, and the point of return is always your breathing. When we're anxious, we hold our breath, right? And we stop breathing. So those are just 2 for me that I think are really, really important.
Thank you, Dr. Gallagher. Are there any other ideas from other panelists as well?
I'll add one. Without going into too long of an explanation of why, there's something called the butterfly hug where you tap right, left, alternating. And it has to do with integrating our thoughts and emotions that are held in different ways in our nervous system. And if you pair that with breathing, as Shauna was saying, and I like especially if it's overwhelmed, I find that about a 4 count in and about a 6 count out of the breath, where there's a longer exhalation, which is more of a releasing breath, paired with this just gentle tapping, does a lot to shift the nervous system.
Thank you, Leslie.
I'd like to add one.
It's great. Everybody's got them. Great.
If you can find a kid to play with for a second, whether it's in the dirt, whether it's in your backyard, whether it's just watching them run around and giggle, this will help.
I want to jump in and just reiterate what Stephen says. So anytime that I have some level of anxiety or depression, I always turn to my medicine people. And who we call medicine people is our little people, right? Who are untainted by this world, who pass no judgment. They have unconditional love. And they are our teachers. They are the closest from the spiritual world, but they're untainted by this world. And so we can go to them and we can draw upon their energy, just like Leslie was saying. And they're very mindful when they're little tiny people. They're not caught in their thought process like we are, right? They're being mindful of their surroundings. So whenever have some level of duress I'm always with my medicine people, which is my grandson and my youngest, to regain that composure and that internal strength. But I have a whole list. I could go on for hours of practices that I utilize with clients in the morning for grounding practices, and then the evening, because self-regulation is acquired through practice, right? And learning to live in the moment to moment living, being present in the here and now, and spending less time ruminating about the past or the future. And this is how we learn to self-regulate.
Sorry.
There are so many ways to position the body. This is the field of restorative yoga. Position the body in a way that hones and brings things inward, and then places the mind in the body, noticing that you can breathe. For instance, your hips wider, you can breathe. The feeling of length in your spine, you can place the mind focus into very restorative, good feelings in the body somatically, taking you out of anxiety and thinking and putting you into calming, relaxing place inside your body and mind. You can also remember that joy always exists internally inside, and you can access that through past memories or imagination, or ways to remember someone you love or who loves you, or a pet, or some fantastic experience that you had in the past. You can go inside and remember that in a way that fills you with good feelings and positive neurophysiology. So there's so many things to learn that are very simple to learn, but they can really make a huge difference in terms of turning off anxiety and turning on well-being through the mind-body experience and the positive psychology understanding of the exercises that also help with that. It's easy to learn. They're not difficult. And I enjoy training trainers. That's what I've been doing recently. And I'm going to be speaking at a International Yoga Therapy Symposium on some of these ideas related to climate change and climate education.
And I just want to say really quick before everybody signs off too is, part of what I feel, as Native people, we teach that connection to Mother Earth, and also understanding community is also about the relationship with our plants and our trees. And I know one thing that I typically teach people who go out into the woods with me is look how the trees live. The trees don't get to pick who they want to live by and what tree's going to go by what. It's just the trees that are here are there, and they protect what's on the ground. And so there's a community relationship of understanding that what we breathe out, the trees take in and give us life back. So we can't live without them, and understanding that connection. There is that level of relaxation and calming that you do get from connecting with Mother Earth. That's why that's why children lay in the grass, and that, neutralization that is created by connecting and sitting by a river and recognizing that life is like a river. The river doesn't get to decide when it changes direction, when it turns. A ripple will never hit that rock the same ever again. And if we put these in the context of life, we are very much like Mother Earth. We are very much like nature, and we can connect and heal in these ways. And so I just want to leave with that get the chance, go outside, connect with the grass and the trees, and understanding that it's a deeper relationship. It really is about connecting and recognizing Mother Earth can live without us, but we can't live without her. And so there's healing through all of that. So we probably have to sign off now, I think. So I thank you for everyone that was a part of this conference. Thank you for everything, for your expertise and everything you've shared. I learned today. I hope everyone on here learned today. And I look forward to seeing more of this in the future. So thank you.
Thank you, Rachel.
Thank you.
Yes, and no, we're not going to sign off yet. We have a few things to go over. One of the biggest things is the survey. And I don't know if I'm running someone over by jumping in real quick, but I really don't want you to go away yet. We want you to please help us by filling out the post-conference survey. Thanks to the Naturopathic Alliance for their fabulous prizes from 8th generation. And it will go to 2 people selected at random from the emails left from people asking for future updates. So please keep in touch with us. Let us know what you think. Will they say good stuff in, good stuff out? So we want to really know and get quality feedback from you so we can move forward. Obviously, I think Rachel mentioned it, and well, quite a few people today. We need more conversations like this so we can get a clearer understanding of where we want to go and how we want to get there. And we can only do that with you as, you know, our cohort, so to speak. I want to go through and thank the contributors for today. And by the way, I want to introduce myself. My name is Daniel Van Arsdale, and I'm an admissions advisor at Bastyr University, handling Masters of Public Health, Masters of Arts in Counseling and Psychology, and Masters of Science and Nutrition, and Masters of Arts in Counseling and Psychology. A wonderful dual program. I'll talk to you about it anytime. But I'd like to thank Claudio Rodriguez, Teresa Turner, Mary Purdy, Daphne Altima Johnson, Fernanda Brusa Molin, Dr. Isaac Emery, Dr. Steve Wilson, Leslie Davenport, Rachel Heaton, great job facilitating, Dr. Shauna Gallagher, Hallie Love, and Lisa Erlinger. I also would like to thank those who helped make this possible. From Bastyr University, Kathleen Lumiere, Lev Elson Schwab, June Klubeck, Mary Purdy, Ryan Carroll, Logan Rost, and Jacqueline Burrell. Those are all ND students. They're students in the process of becoming naturopathic doctors. Krista June and Heather Price. From the North Sound Accountable Communities of Health, Liz Baxter, Tiffany Edlin, and Nika Osteen. Thank you, Nika. Nika's made this look magical throughout the day without just seamless. Thank you, Nika. She's the person behind the scenes, so show her some love. And from Communities of Color Coalition, C3, my heart especially for this organization. They've been around for a while behind the scenes and really are moving up in notoriety here in Snohomish County and throughout the Puget Sound region. And Jackie Julian, director, and Ben Young, I want to thank you all. There's some other things that I've been tasked with, and I'm trying to hit on them like a rock skipping across the pond instead of going in depth. But to summarize the day, I want to show first off that we have had people from California, Georgia, Iowa, and Washington, D.C. here today to hear this conference. So that really shows a great reach. And, you know, some of the quotes that just jumped out to me, Claudio, by putting the power into people's hands, they become the experts. And some of that recurring theme that I heard from Teresa Turner, those that will be least able to cope are most affected. So I think the message is really getting out, and it keeps coming back to, which I use the example of, if you're an emergency medical worker arriving on the scene, you don't just run up and start slapping a cast on the person laying there. You want to assess not only the individual, but the surroundings. That proved true today with people's feedback. Assess the individual and the surroundings. Engage to see where they are of any possible injury or trauma. We heard a lot about trauma today, and that is the impact of colonization. And assess where it hurts, and then proceed to make sure you do no further harm. I don't see any difference in relation to accessing an accident scene by paramedics as I would in how people address the day. I loved, which I stole that link, and we have it available for you all as well, from the doctor that put up the change in climate and how to adjust the change. And I want to show that to a lot of people in following this day. I also had a little trivia. We keep hearing Maslow's hierarchy of needs today. We've heard it throughout the day. And I find it kind of odd and ironic that he spent 6 weeks in 1938 living with the Siksika Blackfoot near Alberta, Canada, where he found shape for his ideas. grounded in the Blackfoot teachings, his idea for Maslow's hierarchy of needs. So I find that interesting that we bring that full circle in utilizing that today. I've seen some great resource sharing today, and we hope to keep that going. Like I said, we put good things into this process, we're going to get good things out. It just works that way. So if you would like to see more community collaborative events, we ask 3 things today. Please give your feedback in the post survey. Can't state that enough. I think we can provide the link in the chat for your convenience. We've done that over and over today, but we could do it again. We also ask if you've learned if you liked what you've heard, please feel free to contribute $5 or $10, which will help alleviate the financial burden on community-based organizations. We typically ask a lot emotionally for community-based organizations and financially, and however we can work to alleviate that, that shows good allyship as well. And with that, please flex your civic engagement muscles by being an ally, by learning more, advocating, showing up in support of events, and being a disruptor. Identify and disrupt the status quo at its root. With that, also, thank you to the Accountable Communities of Health, Bastyr University, Communities of Color Coalition, 350 Seattle, Washington Association of Naturopathic Physicians, and the Naturopathic Alliance. And I have nothing more to say from there, and I hope I covered everything. Catch me if I haven't, and we'll fill in the blanks.